Commissioner Scott, Commissioner Somerville. Thank you.
Thank you. That was a good first roll call. So Brendan is new to this position at the board and welcome and so forth, and we want to make him feel at home and comfortable. So this is our first opportunity for public participation. Just a quick note on procedure. At the full board meeting directly after this meeting, you have 3 minutes. At this meeting, you have 1 minute. There is not a commissioner follow-up section of this meeting. So forgive me, I'll need to be somewhat circumspect in terms of the time management here, but again, you'll have 3 minutes and there's a public comment follow-up portion at the next meeting. So is anyone here for public comment at this time? Right. And Mary, just to set precedent, if you'll just state your name and the municipality in which you reside for the record, please. There.
Thank you. My name is Mary Campbell. I work for Washtenaw County's IT department. I'm also the president of ASME Local 2733. I do not live in Washtenaw County. And actually, my only comment today is I would like to thank the commissioners for one of the agenda items on today's working session, which is discussing the possibility of reopening retiree pensions and retiree health care. I just want to thank you for listening to the county employees 2 weeks ago when they showed up and spoke with you. In regards to that, I was not able to be here. So I would like to thank you today for putting this on your agenda and listening to what you feel or what we feel are valid concerns for Washtenaw County and retaining those employees and possibly, you know, what's the word I want? Looking for new employees it's an incentive to actually bring new employees into the county and for them to stay and finish their careers out with Washtenaw County. So again, thank you for putting this on your agenda and for listening to your Washtenaw County employees.
Is anyone else here in person who'd like to give public comment at this time? And again, as you make your way up, if you'll just state your name and the municipality in which you reside.
My name is Danielle Dix, and I'm a resident of Tecumseh, but I work for Washtenaw County Community Mental Health as a case manager for the last 3 years. For once, I don't have much to say, but this is to address the board and to anyone who has said or may think so. We who are asking for a pension are not whining like babies. We just want our babies to not have to take care of us like babies when we retire. Thank you.
Yeah. Anyone else who wishes to give public comment in person at this time? Okay. Ashley, I'll go to you then. Do we have anyone who is, if you want to give public comment, come on up. And again, your name and
Yep,
residence.
John Sebastian Trim, and I live in Ipsy Township. I just wanted to also address the board in favor of the pension program. That's all.
Thank you. Again, anyone else who wishes to give public comment at this time? Okay. Ashley, I'll go to you now then for anyone who is looking to give public comment online.
Chair, there's no one online.
Great. Move then to our third item. Just a reminder though, again, that we will have a public comment session before our full board meeting after this one. Item 3, any report from the county administrator?
Chair, no report.
Great. Item 4, Ashley, I'll go back to you to see if there's any BOC liaison report at this time.
There's no report tonight, Chair.
Great. Move then to our discussion items. 2 items tonight. The first is the Kids RX presentation. We're very fortunate to have Dr. Hannah with us tonight. And then, as was previously mentioned, public comment, a presentation titled Comprehensive Considerations for Employee Benefit Modifications, Pension and Healthcare Discussion I do want to make one quick note on item B. Leadership met, and we will keep that as a standing item for the next several working sessions, just to keep it at the fore, and also an acknowledgement that we will likely have robust discussion tonight, but there will be need for further discussions, I'm sure, in the future. So we do want to provide that, that venue. But I'll move now to item A, and I just want to welcome Dr. Hannah to be with us here tonight. I will briefly introduce Dr. Hannah to say she is both a public health hero, given her role in the Flint water crisis and the aftermath there, but is leading an exciting initiative here with the Kids RX organization. And Dr. Hannah, I want to turn it over to you. We'll let you get through your presentation and then open it up for Q&A.
Thank you, Andy. It's wonderful to be here with all of you. I appreciate the time and the opportunity to talk about RX Kids. Like Andy shared, my name is Mona Hannah. I'm a pediatrician, a professor with Michigan State University, the Associate Dean for Public Health. And I lead this effort called RX Kids in partnership with the University of Michigan, an initiative called Poverty Solutions. And the program is administered by an international nonprofit called Give Directly. So it's our two big public schools working together, which is like newsworthy of its own, but working together on what we call Team Babies. So you all have a packet in your documents. I was told it's like beneath your working papers or something. It looks like this. And I'm just going to kind of walk through that packet and share what RX Kids is, where we are and where we hope to go, especially in Washtenaw County. So RX Kids is what we lovingly call a prescription for health, hope, and opportunity. And it is an effort to address the economic shock of the perinatal period, which is the time of pregnancy and infancy. So on page 2 in your packet, you see a graph, and I am the ultimate nerd, so I love graphs. And there's a graph that shows that your income drops significantly around the time of having a child. Income drops towards the end of pregnancy. It is at the lowest point ever in the life course around childbirth, and it continues to be quite low in that first year of life. This is the same time where expenses rise. Having a baby in America is very expensive. It's estimated to cost an extra $20,000 a year. So this is the poorest time in anybody's life, is around this period of life. And as a pediatrician, this is the most consequential time of life. It is when what happens in this window of life really shapes your life course. Your brain doubles in size in that first year of life. So RX Kids is this kind of bold effort to eliminate poverty for moms and babies. Every pregnant mother in an RX Kids community receives $1,500 in mid-pregnancy. And once a baby's born, it's $500 a month for either 6 or 12 months, depending on the community. We started this program in the city of Flint, which is where I practice, but it's also the poorest city in the state. It has one of the highest child poverty rates in the nation, with tremendous disparities when it comes to the health of moms and babies. We started the program in January of 2024, over a year and a half ago, as a public-private partnership. With a commitment from philanthropy, but also we were able to leverage for the first time money from the state of Michigan as a TANF redirection. So I'm going to get a little wonky here. TANF, as you may know, is the Temporary Assistance for Needy Families program. It was what happened to cash welfare in 1996 with Clinton welfare reform. TANF is a flexible state block grant. The state of Michigan gets over $700 million a year to provide temporary assistance for needy families. But by and large, this money doesn't often go to families. It goes to other state expenses. Before RX Kids in the state of Michigan, only 7% of TANF dollars was actually going to cash assistance. We shared a different vision of how to care for our most vulnerable families in a way that was child-centric, evidence-based, prevention-driven. So in fiscal year 2024, we received $16.5 million from the state of Michigan to figure this out in Flint. Based on our success in fiscal year 2025, the state of Michigan gave us $20 million in TANF funds to expand this program to other parts of the state, other low-income communities. So if you look on page 6 of your packet, the program started in Flint, but we are now in 11 Michigan communities, including the city of Kalamazoo, the city of Pontiac, 5 counties in the eastern upper peninsula of Michigan, which are the poorest counties of the UP, Clare County, and we launched a few weeks ago in Royal Oak Township and Hazel Park, thanks to the Oakland County Commission. And we are soon going to be launching in other communities in Southeast Michigan. We have been working closely with the incredible champions at the city of Ypsilanti, and I'm here with Katie Jones from the city of Ypsilanti, who has been trying to raise the other funds to make it possible to do this in the city of Ypsilanti. So RX Kids, we have incredible outcomes to date, which I'm going to share real quickly. On page 4, we've been able to prove that our families have improved family financial security. We had no evictions in our surveyed mamas last year and tremendous improvements in housing stability. We have improved nutrition satisfaction, nutrition security. We have a decrease in postpartum depression, improved maternal mental health, improvements in anxiety and parental stress. We released 2 papers this week, which also show massive improvements in birth outcomes. At a population level, we have less premature babies, less low birth weight babies, less NICU admissions, improvements in prenatal care. So this program is doing as expected. It's improving the health of mothers, babies, as well as entire communities. The dollars that are prescribed in this program to date, over $14 million have been prescribed that have gone directly to the hands of mothers and families that have been spent locally. There's a note in here from the Flint Chamber of Commerce, which also supports this program. And they estimate the multiplier effect of giving cash to families because it gets spent in small businesses and the local economy. We've also been able to show significant cost savings just based on some of our outcomes in terms of decreased healthcare spending, decrease in child welfare involvement, which saves our communities and our state, as well as that improved economic productivity. So I'm here today because we would love to bring this program to the city of Ypsilanti. We have already been able to bring in about $200,000 to match the state funds for the city of Ypsilanti, which would be about another $200,000. Those dollars are at the table, but we still have a gap. And we're grateful to the city of Ypsilanti, which has committed $100,000. The DDA committed another $50,000. We've also had some gifts from philanthropy, and we continue to work to raise some other philanthropic dollars. So we would, I'm open to answering kind of any questions. If you look on page 7, you can kind of see the family of funders that have come in to support this program. We have raised over $100 million in the last couple of years to bring this plug and play, evidence-based, efficient, effective program to, once again, 11 Michigan communities. And I look forward to any kind of questions or comments.
Dr. Hannah, thank you. We really appreciate your presence here tonight, and thank you for moving through that presentation. I'd like to open it up for questions from the commissioners. I'll just set the precedent real quick. You mentioned on page 7 these committed partners. I see Kalamazoo County government and Oakland County government. Can you tell us just a little bit about what commitment or role they are playing just as peer county governments?
Yeah, so I don't remember the dollar amounts. I think Kalamazoo committed in the millions to help the county, and the city committed to help launch the Kalamazoo program. And the champions in that community included multiple stakeholders from different sectors, their community foundation, their an infant mortality collaborative, and different folks, but the county and the commission, the city were very involved. Oakland County committed $500,000, and that was the match, all the match that was needed to launch the program in the city of Hazel Park and the city of Royal Oak Township. The city of Pontiac had already gone live, so they strategically wanted to go after their 3 poorest communities, Oakland County. The city of Pontiac was also able to go live because of a $500,000 commitment from the city of Pontiac. Other counties are in the process of contributing. Those are not public yet to make that match possible. So once again, it's matching state dollars that are already at the table with a blend of philanthropy. The philanthropic dollars, $1 of philanthropy in this program and each cash transfer also allows us to protect other public benefits. So this will always be a private partnership. The philanthropic support allows this to count as a gift and not income, so it doesn't impact folks' eligibility for WIC and SNAP and Medicaid and all the other benefits. So county governments have been involved.
Great. Open it up to colleagues for questions here. Commissioner Hodge.
Thank you, Chair. Thank you for the presentation. Really excited about the program. I wanted to thank you too for your commitment to public health, particularly in a time when public health is constantly under assault. I also wanted to thank you. So some time ago, you did a commencement speech at the University of Michigan School of Social Work.
Oh, I did.
Yeah,
It
I'm
was lovely.
faculty there and I sit through a lot of commencement speeches and that has been one of my favorites, I think, that I've ever heard there. So thank you for that. And the students really appreciated it.
Thank you.
With this, I'd be particularly interested in what it would look like for us to have a countywide program. I don't know if you have the data on what a potential, like the cost could look like for us if we wanted to do that. I know the city of Ypsilanti is working on that and there's the cost projections for that, but we were going to try to do this countywide. Do you have a
Yes.
sense of how much that would cost us?
Yeah, I would love to do it countywide. I would love to do it statewide. I would love to do it for the whole nation like other countries. 70% of countries in the world do some sort of child cash allowances. We did it as a nation in 2021 during the expanded child tax credit where most families got unconditional cash allowances and that was not renewed. So right now we are targeting the poorest places. I wish, I have the numbers. I'll share you the numbers of Washtenaw County. But as a county, it's not one of the most highest need counties in the state. But you have pockets of need, and that's why we're going after the communities that have the highest pocket of need. But I'm happy to share those numbers with you later.
Thank you.
Go to Commissioner Somerville.
Thank you. So my district covers the whole city of Ypsilanti, but I also have parts of Superior Township and parts of Ypsilanti Township. And when you look at the opportunity index for Washtenaw County, my district is almost entirely dark red. And so I'd be interested in figuring out a way if the county is going
Yes.
to commit any funding to be able to
Yes.
cover the darkest red parts of Washtenaw County. Because it's kind of hard for me as someone who represents a district with really high poverty to just say, if you live inside of this city, you can participate in this program. But if you're just outside of that, like across the street in Ypsilanti Township, the county dollars aren't going to go to you. So I've been struggling with like this concept because of that, for that reason. And we have, yeah, like even if we just looked at like some of the outside of the city in Ypsi first, but there's also some rural parts of Washtenaw
Yeah.
County that are dark red as well. Just hearing the numbers that other counties have committed, I think if we're going to commit to the level of what other counties have done, we need to be able to do it outside of just the city of Ypsilanti, because otherwise it's not going to be equitable, even though this is my district. I will say, these guys all know that I fight really hard for the city of Ypsi all the time, but I'm trying to figure out how we can look a little bit bigger than just the city of Ypsilanti on this, because the second we do this, if we did this just for the city, we're gonna get calls for people from Ypsi because nobody understands that they live in the
Mhm.
city or the township or Superior Township.
Yeah, I get calls every day from people across the state that say, when is it coming to my city? Even though we are the largest and most inclusive program of its kind, we are running, this is the largest cash transfer program in the country. There is no other cash transfer in the country that is universal. They're all means tested. You have to, make a certain amount of money, you're not, or you have to, this is the most inclusive program. I get that all the time. A woman outside of Flint who lives just literally the block over in Kalamazoo that's not part of this. So I would encourage you to start with the places of highest need. Think of it as a pilot and then phase in those other communities. But it would be fantastic to have more resources to be able to do this in more places. Once again, in the UP, we're doing a 5-county contiguous region. So we are doing entire counties, but it all depends on the dollars at the table. But start, just at least start. Don't wait. Start at the places that have the highest need. And once again, this is a plug and play program, super efficient. We can, we launched the last 3 communities we launched, no new staff are hired. We can, with dollars at the table, we can launch anywhere within months, and we're even expanding to out-of-state communities.
Commissioner Light.
Excuse me. Hello. Thank you. I was able to attend your presentation at Eastern
Yeah.
back some months ago, and I love this program. And as Commissioner Somerville said, her and I, we share a portion of our district in Superior Township, and that is the portion. It is a lot that is red there. And then the rest of my district is, a lot of it is rural. As you travel on down to like Northfield, Whitmore Lake area, there's a high need and this would be needed, but that's why I like the need for it to be countywide. And I just want to try to figure out and strategize on a way so that we can get it countywide, because the rural community and is just as more like the more dense areas Ypsilanti, and the same needs are needed. And so just want to strategize and try to figure out how we can do that. Maybe if this can get implemented into our Washtenaw County health plan, or just ways that we can figure out how, as Commissioner Somerville said, because we're gonna get the calls, like, well, what
Yeah.
about us?
Yeah.
Well, why can't we? And, it won't be equitable because portions of the county are the same, but just in different areas. And so just want to figure out how we can spread it across. And as we know how our economy is right now, just on how we can budget it out, make it sustainable to last. And so we don't just get one trial of it and then it's gone.
Absolutely. I completely agree with you. Once again, I would totally support doing this countywide. But for me, equity means really starting at the places where they have the highest need. So I think that'd be great to start to look at the maps, start at the places with the highest need. Kalamazoo for sustainability is also looking at a millage, potentially a countywide millage to support this in the future. We are in active negotiations kind of with the state and other entities to see other ways we can sustain this. We're saving a lot of healthcare dollars. We're talking to, for example, CMS to make sure to see if we can draw down healthcare funds. So there's lots of different possibilities. But we don't think we have to figure all that out. I think once again, we can be very data driven and start with the communities, 1, 2, 3, where this is needed the most. But I totally agree with you.
Commissioner Robbie?
Thank you, Chair. Wonderful presentation. Fantastic
So good to
job.
see you again.
So good to see you again. Absolutely. It is. It really is. You do amazing work and we thank you.
Like
And
all
have
of
done
you.
amazing work for such a long period of time.
Thank you.
advocating For people. I know, not about you, it's about the.
It's about the babies.
program.
This is about the babies.
That's right. I was gonna ask, so some of this conversation about other communities too. Is there state legislation around this? And then there's, Senator Santana introduced a bill related to this. Do you want to talk about that bill at all and how it may impact the program moving forward if it does pass?
Yeah, so there was a bill to codify this, to put this in legislation, but that doesn't come with the money. So the money still has to be appropriated. So the governor put in her executive budget recommendations an ongoing 20 million as a TANF redirection. The Senate, hearing from people across our state who want this program, increased that to 78 million as a mix of TANF and general fund dollars. So we wouldn't have to have as much other dollars. They still want municipal buy-in, they still want philanthropic buy-in. So the Senate in the HHS budget right now has $78 million for this. The House has zeroed out all funding in their austerity plan. So I just came from Lansing a few hours ago, so we're in active negotiations, as I'm sure so many are, to see where we will land with the state budget and what that sustainable path looks like. There is a potential of a one-time appropriation for 3 years of funding, which would also give us a more sustainable path for at least for the next 3 years, but I have no idea what's going to happen.
Well, best of luck with that advocacy. I think, that would be such a catastrophic shame if the Republican budget is adopted anywhere near it's currently introduced.
Yeah.
As you said, austerity budget, and people's lives are on the line
Yeah.
as you're talking about. So hopefully that doesn't happen. I don't know if you mentioned a few dollar figures, but not necessarily like what it would cost for the county to potentially contribute, at least not that I heard. If I missed it, I'm sorry, but, and it sounds like it's a match, so it sort of depends on how much we want to put in to do
Yeah.
it, but I think there's a goal to reach the 6-month mark, right? That's kind of how.
Yeah, I think that's the lowest priced option is the prenatal plus 6-month program. The numbers I have are just for the city of Ypsilanti. It costs about $650,000 in total to do this for the city of Ypsilanti for the prenatal plus 6-month program. Over 200,000 would come from the state. That's dollars that are already at the table. We have over $200,000 in commitments. We have $300,000 in pending commitments because of grants that are being written. So I think there's a gap of about $500,000-ish. Is that right? $500,000 for the city of Ypsilanti to do this for 2 years. Right? For 1 year. 2 years? For 2 years. So we're close. We're almost there.
So you've, between state and local and philanthropic money, it sounds like 600,000 is what you've raised already, and you need to basically double that?
Yes, we have about 600,000 in commitments from state TANF dollars, from city dollars, DDA, philanthropy. So there's about $600,000 that would be needed to make this possible for 2 years in the city of Ypsilanti.
Okay. It would be interesting, I think, if we're gonna explore this conversation. Well, I guess let me ask this too. In line with what Commissioners Somerville and Light were discussing, is it true to say that the way that communities are selected so they're selected through this organization's process? And so if we wanted it to be a larger geographic area of Superior, Ypsilanti,
Yeah, that's.
and Ypsilanti Township, how would that happen? Like, what's the process?
So communities are selected based on need. So we're not going to go to an affluent community. So we're going to go to high need communities. And it's based on our ability to leverage a match. So can we raise together the additional dollars to make this happen? We have the state dollars, but that's not everything that's needed.
So, but the state dollars, do you get the state dollars?
It's reimbursement based.
But is there like, I guess what I'm trying to get at, is there a qualification for a community to receive the state dollars, or?
The community doesn't get any money. It all goes to to Michigan State University
Sure,
on a
but-
reimbursement basis.
But we're designating, in this case, Ypsilanti City is the community we're designating.
Yes.
So if we were to designate a 3 municipality
Right.
area, then the state would still reimburse.
Yes, all
Okay.
those communities. Yep.
Got it.
So Oakland County, we're in 3 communities, 3 high need communities. It's anybody who are in those 3 communities that are eligible.
Okay. Is it,
And we get the state dollars.
my last
along-
question is, do you have to include the whole municipality, or can?
That's a great question. So it has to be something that folks can easily figure out if they're eligible. So we can't put their census track. So it has to be a
Zip
zip
code?
code.
Okay.
So we have expansion plans for the city of Detroit, which is ginormous, and it starts at a zip codes of need. But it's easier to do a whole city.
Okay.
But zip codes are also possible, and we're happy to do those numbers.
Zip
has
code
to be
might be
something
interesting.
That
but-
people understand. The easy eligibility is we have a 100% aggregate take-up rate, so which is just fantastic. Everybody who we compare to birth certificates, everybody who's potentially eligible is really in this program compared to other programs like WIC has a 50% take-up rate.
Mhm.
Visiting programs have a 20 to 30% take-up rate. Part of that high take-up rate is because it's easy to understand eligibility.
Okay, thank you. And just to clarify, this isn't a question, but the $600,000 that you would need, that would cover 2 years of the payment. So,
We like to have 2 years committed before we launch in a community. We don't really want to do something for 1 year, as we can always continue to work on long-term sustainability policy solutions.
but on an annual basis, well, you don't have reoccurring funding from the other partners at this point.
Some
So
are
it could-
multi-year gifts, but the ones that we have right now are one-time gifts.
Okay.
But
All
we
right.
have a grant that's going in for IPSI, that's a 2-year gift.
Got it. Thank you.
Great questions.
Go back to Commissioner Somerville.
I have a few questions. How are you estimating like the need? So like the entire city of Ypsilanti is around 21,000. So like, how do you determine what it's going to cost for a 2-year?
Yeah, so it's all based on vital record birth certificate data. So we know how many babies are born every year from vital records. We have a data use agreement with Michigan Department of Health and Human Services, and we know what proportion of those babies are Medicaid babies. So that is kind of our best objective measure of need, is the Medicaid birth rate in the community.
Gotcha. And then when you all like identified Ypsilanti as the highest need area, were you just looking at the city, or were you like looking at the whole region? Like, did you consider Ypsilanti Township and Superior Township?
Yeah, so we didn't come to Ypsilanti, Ypsilanti came to us.
Okay.
And that's by and large how it's been for most of our communities. We are happy to go anywhere where there's need and where there's incredible partners who are putting dollars at the table. So they came and they said, hey, we have money, let's help figure this out.
Okay, so it wasn't like the other way around where you were reaching out to municipalities?
No.
Okay,
But in our further expansion, if we do have potential more money from the state, it is very much driven by need, but there's always that public-private partnership. We can't launch anywhere without support from that community.
okay, thank you.
So, Dr. Hannah, just a few logistical questions. if we were able to do this anywhere in Washtenaw County, what does that process look like if I'm a new parent? Sort of who administers it? And oversight is the wrong term, but who sort of rides herd on this in terms of making sure that it's working, that the money's getting distributed where it should, and is there any prohibition in terms of how it's spent on the recipient end?
Yeah, these are great questions. The program, once again, is led by Michigan State University. We have been, by and large, the fiduciary for most of the grants. The TANF money comes to MSU. The other funds from other municipalities, some have come to MSU, some have gone right to Give Directly. Some have gone to a community foundation. For example, in Kalamazoo, all their municipal funds went to the Kalamazoo Community Foundation that then went to Give Directly. But by and large, MSU, as most universities and bureaucracies are, have lots of checks and balances, lots of auditing, lots of general counsel, lots of pre-awards and post-awards people. So there's lots of eyes on this. Give Directly is, once again, the nation's leader in cash transfers. This is all they do. Once we are live, once the contracting is done, once we have enough resources, we can go live fairly quickly. Most commonly, people hear about the program by word of mouth or social media. And we very quickly are at that 100% take-up rate, which we can verify through birth certificates. We also work closely with local champions, cities or health departments who help spread the word. We have rack cards and pamphlets. We have celebrations like baby parades, very much kind of celebrating.
So
this-
baby parades.
We have baby parades in our communities, and I can see all the county commissioners being kind of grand marshals of those baby parades. We've had them now throughout the state of Michigan, celebrating this historic investment in our families. So often our families and especially our mothers are vilified, and it's just so hard to be a parent. And we are changing that narrative. So yes, we had baby parades. We had baby parades over a century ago during the Children's Year, but that's a different story, and I'll talk about history later. So there's a lot of celebratory events that can happen in a community that's really done locally. We let our local champions kind of lead those because your community is the best. So families enroll online, rxkids.org. The majority of families enroll on their phone. 90% of families enroll in pregnancy. It takes about 10 to 20 minutes. They upload verification of pregnancy, residency, and or childbirth. They can choose to have a direct deposit into a checking account, which 80-90% choose that direct deposit because it's easiest. And other folks can choose to pick up a reloadable debit card. So there's one staff that would be hired for this region for somebody to make an appointment to pick up that card. It's available in multiple languages. We're launching in many communities in Southeast Michigan. There's a whole slew of languages that are now available. We already have Spanish and Arabic and English on there. There's customer service, there's benefits counseling, lots of different services or resources for families to take up, but generally a very high satisfaction rate of the program. Very efficient, unlike the majority of social services out there. It's very dignified, and that doesn't have any stigma because it's universal, and it's pretty seamless. And a very large safeguarding program that protects the mamas as well as fraud detection.
So if we did a pilot in Ypsilanti, the city proper, just based on what you're talking about in terms of sort of picking a jurisdiction, we could expand it to a multi-jurisdiction area.
Yeah.
Could we use ongoing philanthropic funds to continue to supplement it? You mentioned Kalamazoo's exploring a millage, but if we had an
Sure.
endowment or something, some other mechanism, would that?
Absolutely. So Kalamazoo got $5 million from the Stryker Foundation, and then they got money from municipal and small other funders. Oakland County started in Pontiac. That was the first city in May. Then they were able to get extra money, and then they launched just in a couple weeks ago, these other two communities, but they wanted to start somewhere. So we and, all of us will work together. We just came from a meeting with the Ann Arbor Community Foundation. There are lots of folks that are committed to making this possible for the surrounding region.
Okay. Last question. Sorry to be greedy here, but we've been talking a lot about Medicaid at this table and the big fear around the migrations that'll take place within the Medicaid system and how they're hoping to sort of kick folks off through paperwork, re-upping the renewal to 6 months rather than a year and so forth. Do you have or work with any entity that sort of goes out and proactively looks for folks who are new parents, who may not be aware, or may not have heard at, events and those sorts of things?
So every baby born in an ARCS Kids community, to make sure we don't miss them, we have a data use agreement, once again, with vital records. So we know, we have all the birth certificates for the state. Every baby that's born gets a welcome packet in case they're missed otherwise. But once again, 90% of people sign up in pregnancy. They hear about this. It's a very popular. They think it's a scam. That's the most common problem. People don't think it's real. Like, are you serious? You're giving me money to have a baby? This is amazing. But once they find out it's real, they sign up. But to make sure that we don't miss anybody, every baby gets a welcome bundle. And in that welcome bundle is a personalized card. Welcome to the world, baby Andy. We're so happy you're here. Sign up for this program if you haven't. Here's a website where you can find other amazing resources in your community. That packet also comes with 2 really cute onesies. One says love, because fundamentally this is about love. One says best baby ever. And that packet also has a card from the governor, a thick cardstock card that says, we are so happy that you are here, our newest Michigander. We love you and we can't wait to see what you become. So that is kind of our last ditch effort to make sure that we do not miss anybody. And once again, based on aggregate data, we have a tremendously high take-up rate.
But it's certainly something where our public health folks or private healthcare institutions could
Yeah.
spread the word. And
Absolutely. We have posters and rack cards in doctor's offices and WIC clinics, all over, and marketing and commercials and social media ads and different things. But I've spent my whole life in medicine and public health trying to reach people, trying to find those hard to reach people. This is not the case in this program. People value it. It's easy to understand, and and they sign up.
Well, I'll see if there's any other commissioner questions. My 2 cents, just as one commissioner, is I am very open to the when and where, but I'm very interested on the yes option. So I'd like to find a way to put this to work and at least have one Washtenaw County community on there. So
Yeah, once again, we'd love to do the whole state. We'd love to do the whole county. We'd love to do pieces of the county.
any other commissioner questions at this time?
Thank you.
Dr. Hannah, we really appreciate you being with us
Thank you.
tonight.
Thank you for having me. I appreciate it. On behalf of all of your babies, thank you.
Thank you. We don't often give rounds of applause after presentation, so well done, well done. We'll move now to our second discussion item. Tina Gavalier, our CFO, is here with us tonight. As previously mentioned, there was discussion about the question of employee pension plan, as well as healthcare considerations. And Tina is here to walk us through some of the facts and situations we need to consider as we look at what options are available to us. And Tina, why don't I turn it over to you, and then when you're done, open it up for any commissioner questions.
Okay. Good evening, commissioners. Let me just test this out. It works. Thank you, Ashley. She's helping me out. I'm doing it the old fashioned way. I figured if I had a laptop up here, it would not go good. So we're going to start off with a broad consideration and then tailor down towards retiree and retiree health. So the agenda is displayed on the screen. I won't talk about everything, but each negotiation that we start, we always start the conversation at total compensation. So I want to give everybody the same playing field as we move through this for consideration. So when you look at total compensation, I provided some information on the 2025 labor summary. We have 1,594 budgeted FTE. That equates to 207.1 million in total compensation. 62% is for wages and 38% is for fringe benefits. We always give you information on what component of the general fund positions are. Of that 1,594 budgeted FTE, 40% or 639 positions are in the general fund. 60% or 955 positions are non-general fund budgeted positions. But do recall that you do have a policy that the general fund, if the non-general funds cannot cover wage and benefits, the general fund picks up the non-general fund portion that can't be covered by grants or what have you, or their program funding. For wages, looking back since implementing our current compensation structure in the second half of 2022, we've increased base compensation 35.6% and paid full-time employee lump sum payments, as well as ARPA premium pay. And then for fringe benefits, during that time of that compensation study, there was 2 results identified for fringe benefits where the county was below the benchmark for fringe benefits of the entities that were polled in the survey. And I have all the details if you want me to go further in, but I'm going to keep it at a high level so we can get through this and then you can start your discussion. And the 2 areas were just the vesting schedules for defined contribution retirement plan, and then not providing medical or dental waiver payments if an employee waived taking insurance. So let's delve into a little bit more into the total compensation. For comparison purposes, I've provided, because I've mentioned the 2025 labor study, I provided the fringe benefit formulas for 2025 based on if you're a public safety employee, depending on union, as well as non-public safety employee. And then the 2026 fringe benefit formula, because we just got our medical renewal in a week ago, Monday. So it appears that if you look at the flat dollar rate fringes, which in 2025, there was 3 components: medical, a flat dollar amount for retiree healthcare contribution that the employer provided, and then for dental program. The biggest component of the 2025 formula was for medical that equated of that 22,536, 19,130. If you look at the 2026 formula for the flat dollar amount fringes, it only includes 2 components, medical and dental. The flat dollar contribution for 25 for retiree healthcare changed to a % based on the actuarial valuations that we just received in July for the 12/31/24 valuations. So there was an actual increase. And so for comparisons, I had mentioned that 19,130 was medical in 2025. And for based on our medical renewal for Blue Cross Blue Shield that we just received, it will be $20,086. That's a 5% increase over 2025. And when you look in terms of this is as budget, we will get into actual numbers in a minute, but as for the formula, we built in a 5% increase for active medical costs. Now shifting a little bit over to the fringe, the % fringes, the largest components of the % fringes that you see as a part of salary is for employer retirement contributions and retiree health contributions for 2026. I do want to mention during board leadership, when we talked about the agenda of this presentation, there was an additional item added that I will cover in a few slides. But because that item was added, I did include a comment with regard to the fringe benefit cost formulas that in 2025, our medical renewal came in above the PA 152 hard caps, and the board elected to have an exemption option. That was the second time in 3 years that occurred. The first time was in 2023. We have also facing the same situation for 2026, and that amount is 4.3 million. So 3rd time in 3 years, and will require some type of action to get us back into compliance, which I will give some options in a minute. Fringe benefit expenditure history, just wanted to provide some high-level idea of total employer cost of the current benefit structure that's provided. So in totality, I know it's small, but 77 million for 2024, over 68.7 million for 23, 69.5 million for 2022. And again, medical, retirement, and retiree healthcare make up the highest portion of costs in totality. Fringe benefit costs have increased in totality 12% between 2023 and 2024, 19% since 2017, and then 24% since 2020, and 37% over the last 10 years since 2015. So it outpaces inflation a little bit and until we get to the current inflationary factors. But prior, when inflation was 2 and 3%, our fringe benefit costs are exceeding inflation. And the trajectory of cost increases is not sustainable under the current benefit structure. So I'm going to tailor down now to medical cost expenditure. And the reason I'm covering medical costs specifically is, again, is the Public Act 152 options that we will segue into on the next slide after I cover this. But medical is the largest component of the flat dollar fringe benefit formula. Displayed is the 10-year history, as well as what's currently projected for the current year for both actives and retirees. And you can see that it's higher trajectory of increases for actives, flatter for retirees. And we'll get into some reasons for that in a little bit when we talk about retiree health care. But just as for consideration as you're viewing this slide, the 2026 Blue Cross Blue Shield renewal increased 18%, or 2.3 million over the 2025 projected retiree healthcare costs. So retiree healthcare costs will be the highest in ever, or anticipated to be the highest in 2026 than ever before at 15 million. Now remember, the VEBA plan pays the cost of retiree medical. So even though it's going to be a $15 million annual cost, the county contributes to the VEBA plan for those costs. So we don't contribute 15 million every year from the VEBA plan. That is actuarial determined based on our valuation. And we'll get to the current year or what we contribute in a little bit. But just for the perspective, it's at 2.6 million estimated for 2026. It doubled over 2025 at 1.3 million. For active employees, the Blue Cross Blue Shield medical renewal rates came in 26.2 million, or 8.75 increases over the 2025 renewal, and over the PA 152 hard caps by 4.3 million in aggregate for all plans. And again, that was for the third time. Just to recap, 2.8 million was covered in 2025, and 877,000 was covered in 2023 when the exemptions were put into place for those two years. And then again, to cover the gap over the hard cap, the board will have to authorize one of the options outlined on the next slide. So there's 3 different options, and I believe board leadership asked for these special prepared slides in advance, and then I did forward them to the board late yesterday afternoon. They were draft. They have been revised, so I will submit after the presentation. I will get those back out to you, and that did change a little bit of the prepared draft cover memo and resolution as well. So I just wanted to make sure that we had a late meeting this afternoon, and our agent of record was on site, and there was a formula change in one of the spreadsheets that I wasn't making sense to me, and so we figured it out and she corrected it. A lot of what you're getting, a lot of information. It's not all Tina Gavalier or finances information. You're getting a lot of conglomerate of information from many, many sources. But the 3 options for compliance with Public Act 152 is hard cap option, which limits the public employer's total annual health care costs for employees based on the coverage level defined in the act. So each March about the state publishes the hard cap amounts, and that what we're over the hard cap in the renewal is 4.3 million. Then there's an option for limits the employer, section 4 or 80/20 they call it, limits the public employer share of total annual healthcare costs to not more than 80%. That option requires an annual majority vote of the governing body, and the employee covers 80%, which would be 21 million of the 2026 Blue Cross Blue Shield renewal, versus 20% that would be passed on to the employees at 5.2 million for healthcare costs to get to the total renewal of 26.2 million. And then section 8, the exemption option, that exemption option would absorb the county would absorb the full amount of the cost over the hard cap of the 4.3. If approved that this again would be the 3rd time it would cover the cost over the last 3 years. If the board decides not to cover the $4.3 million increase over the hard cap, increased premium sharing will need to be negotiated with our union partners. So on the next slide, the impact of the increased premium sharing for option 1 and 2 are highlighted, and I will do my best. Again, this did change from an earlier draft that you may have all seen. The county provides 4 healthcare plans to active employees. And this information is from Brown & Brown, which is our agent of record. And what they do for us, they assist us with administration of benefits, rate development, and compliance with legislation and covered, and they do periodic coverage evaluations. Most employees are enrolled in PPO 7 or the high deductible healthcare plan with a health savings account contribution. Also provided are the premium sharing amounts of the county's available buy-up coverage for PPO 1 and PPO 2 at the bottom. But compared to the other two plans, there's probably only a total of 18 people in those other two, and PPO 1 and PPO 2. So I really do want to focus with regard to where the majority of the selections for medical are. So the yellow highlighted monthly premium sharing amounts are what has been negotiated in our most recent settled contracts. The green highlighted columns and amounts are the monthly premium sharing amounts based on enrollment tier that would be for option 1, the hard cap options without opt-out of PA 152, and option 2 with 80-20%, which limits the public employer share of total annual healthcare costs by plan to not more than 80%. So the calculation for option 1 is taking the monthly premium amount, the monthly premium sharing, monthly premium sharing amount, which is highlighted in yellow for PPO 1, 2, and 7, and adds the over or under PA 152 amounts to determine the employee premium sharing amounts for alignment with the hard cap option or no exemption. If you see over or under PA 154, every column is positive. Every plan's premium sharing amount is under the hard cap requirement. For the high deductible healthcare plan, it adds the over under of PA 152 amounts to the monthly amounts for the HSA contribution, because that is a county cost, so that has to be included in the formula per the state guidance. Option 2 calculations for PPO 1, 2, and 7 takes the 2026 monthly premium amount, the total cost of providing that coverage, and multiplies it by 20% to determine the employee premium sharing amounts, and for the county or the employer to not pay any more than 80% of healthcare costs. For the high deductible healthcare plan, it takes the 2026 monthly premium plus the monthly HSA and then multiplies that by 20% to determine the employee premium sharing amounts. I know that's a lot of data and information, so if there's questions, please let me know. We're getting closer to pension and retiree health, I promise. Oops. So just wanted to kind of summarize cost containment efforts that have been achieved during the most recent negotiations. So because healthcare, we were able to increase premium sharing and then also offer a high deductible healthcare plan. We attained savings of approximately 1.8 million for 2025, or 8.65%. But remember, we turned around and did the exemption option for the PA 152 that cost the county 2.8 million. So really, we ended up spending $1 million more than what was planned because of that action. Employee parking offset about 82,000 or 12% to 138,000 or 19% of total parking. And the reason that that's the window is at the time we negotiated it increased to the monthly parking amount. We were using data from 23 and 22, and the numbers were substantially different with regard to our totality of parking. So just giving you that range of what we accomplished based on, depending on what year of expenses you're looking at. And then employee, also, we negotiated parental leave. Parental leave, we didn't seek any cost containment of legacy costs or sick time payout for new employees because the board directed us to move away from that. But the employees did gain a guaranteed parental leave of 10 to 12 weeks. We do now know that it costs $838,000 for fiscal year 2024. That's only salary and fringes for parental leave takers. It does not include possible increase overtime costs or temporary assignments or hiring temporary employees to backfill the work. We are trending per HR, we are trending higher in parental leave usage for 2025 and expect the cost to exceed 1 million. And that's again, not including those other get the work done costs. So I wanted to kind of also, we have a liability on the books for paid leave time. I just wanted to kind of demonstrate that making a decision on parental leave, there's different facets and positions on that. Not saying it's a bad thing, but it does have an impact on liabilities for the long term. So what compensated absences, it's, the county has paid leave time system, and there's payout negotiated with the unions and union contracts. So because when people earn paid time off, and if they terminate, there is, they can realize a certain payout amount. And so therefore there needs to be a liability on the book. So I gave 2024's liability in comparison to 2023's liability. And it just, because parental leave, people don't have to take sick time for leave for having anything related with a child. So it increased our liabilities by 3.1 million because we didn't have an offset of potentially of reducing sick time payouts. So getting to the topic at hand, pension and retiree health care. So the first time WERS pension was reopened was during a 3-year period in 1996 to 1998, and the second time was at the end of 2008, beginning of 2009. And then a review of the records indicate that VEBA was closed once, and that was at 12/31/13. So this slide actually was a request of labor when we started the conversations with considerations for reopening pension. So the actuarial reports from the 1990s are very boring and very narrative compact, let me tell you. You'll see in a couple slides that the more recent actuarial reports, because a lot of the information that I'm using for demonstration purposes are graphs and charts and things that are much more pretty. So anyways, the same section of the actuarial reports we reviewed and evaluated to provide a comparison over 5 years of the impact of reopening in the 90s. And it includes reason for change, the contribution rates, the determination of the employer normal cost, and unfunded liability calculation. So the table provides that information. And specifically in 1995, the year before the first reopening, and the information shows that WERS was overfunded at 100%. And then 1996 to 1998, 3 years of reopening, and 1999, the year after the reopening period, has been underfunded and has never been 100% funded again. And I won't read the chart, but all that information I have, thankfully to HR, they have actual reports since the beginning of time. So it's very. All right, so there's a lot going on in this slide. And again, it is to give you some tried and true actuarial information. So in the upper left-hand corner where you see bars and a line, that's the reopening of WERS and occurred in 2009. Actual, the defined contribution balances from the MPP program were closed out at 12/31/08. When the UAAL, the unfunded actuarial determined accrued liability, was 65 million, and the funding ratio was 70%. 3 years later, at the peak, the UAAL peaked at its highest level, and the funded ratio dropped to the lowest point. The actuarial did confirm that the reopening could have contributed to this. Also, economics could have contributed to that, but also to note that right around that time, the Great Recession occurred. But since 2014, closing of the plan, the funded ratio has remained relatively flat. This is due to the liability experience, salary increases higher than expected, and more retirement benefits paid than asset experience of investment returns and contributions could cover. This is anticipated to continue because it will take a full 3 years to realize the wage increases in the data. The full impact of the 2022 wage increases will be reflected for the first time in the 2025 valuation. Wage increases through 2025 will be reflected finally in the 2028 valuation. So that just kind of gives you the trajectory of what has occurred over time. The historical cash flow slide, that's just the contributions in 2011 would have been based on the 2009 valuation, the year that we reopened in the actuarial report. The difference between the numbers on this slide and the WERS employer retirement contribution would be the employee contribution amounts. So on the very bottom, it says employee contributions, retirement WERS and retirement health VIBA. That's those two amounts over time reconcile back to that 10-year fringe benefit expenditure history. And you can see our for WERS, our contribution for 2024 was 17.6 million currently. And then you can see the population for active employees, it's 346, and retirees, there's 1,037. So that's kind of just how you're tying all that information together. Shifting to VIBA retiree healthcare system was closed in end of 2013. It is expected that the trend to reopen VIBA would have similar experience as WERS reopening, or worse due to the volatility of healthcare costs, because the entire responsibility and risk of the defined benefit program rests with the employer. So note, the VIBA impact of events on results is the most current actuarial report, and the UAAL, which is the unfunded actual accrued liability, actuarial determined accrued liability, was 12.8 million. That was 47.4 million higher than expected, which was on slide 20 of the actuarial report. The funded ratio dropped to 93.5%. We were overfunded in VIBA for 3 years, and we are no longer overfunded. The actuarial determined county contribution more than doubled from 25 to 26. So we're looking for 26, 2.63 million, and it was 1.3 million for 2025. And you can see the second bar graph that's just gray and blue, I believe, if my eyes are right. That gives you by plan the increases of the retiree health plans that we currently provide. In aggregate, it was 12 to 15%, but some plans, you can see that one bar graph, quite a bit of an increase, some more than doubled actually. Per capital claims and cost escalations collectively across all plans increased at 12 to 15%, but individual plans were much higher. And then again, I gave you a snapshot of VIBA membership slide that came from the actuarial report, and then the employer WERS pension and VIBA healthcare expenditures that I've already mentioned at the bottom that reconcile back to a previous slide, slide 5. So industry expert information. So attended both state and national conferences. So at MAPERS Fall 2025, there was a retirement without compromise, honoring the promise, securing the future with healthcare costs rising and financial pressures mounting. The session explored practical solutions for plan sponsors to provide health retiree benefits that are efficient, cost-effective, and meaningful, while reducing the risk of both the municipality and the retirees and ensuring long-term sustainability. And it included a case study. So I provided a link, just we don't have to have a one-size-fits-all. There should be more considerations. And in a few slides, I got to best practices that reiterate a lot of things that we have learned in conference attendance. Upon delivery, it should be noted, Upon delivery of the 12/31/24 actuarial evaluations, CAVMAC, which is our actuaries for both WERS and VIBA, have cautioned that the reopening exhibits prepared by the actuaries previously shared with the board and our union partners were based on the 12/31/23 actuarial evaluations and are outdated because of the 24 report being issued. And then, as mentioned during the last slide, VIBA results changed substantially. We had 28% falling of our funding level, even though we're 93. I mean, we're in a good spot and it's not, crazy low, but if we would have been funded at, 75% and it dropped 28%, we would have to file a correction action plan with the state of Michigan because it would have fell under 60% funded. So that's just an example of the consideration. And then both plans will have experience studies conducted after the 2025 actual evaluation to provide more information to the respective boards for the history of experience and options for future assumption modifications and considerations. Conferences both within the state and nationally have been pretty consistent on information sharing with regard to pension and retiree health systems. There's a summary of information from, I focused on a summary of information from MAPERS because it's the Michigan Association of Public Employer Systems. So it gives you some snapshots with regard to, how many pension systems are open versus retiree healthcare systems. In the industry, retiree healthcare systems aren't being reopened because of the volatility of healthcare expenses. And then pension systems that are being considered across the nation and the state are for public safety unions. And our public safety union still has MERS, which is a DB program. And I will mention there, again, there are some proponents for reopening closed pension system, but it's been focused on the public sector employees and specifically to address recruitment and hiring issues. When we started a year ago, when I attended a MAPERS conference, kind of talked to CAVMAC and our attorney with regard to specifically asking their perspectives around reopening pension and retiree health. So again, the attorney reiterated that pension systems were being reopened for public safety employees, but with a much different benefit structure under the current statute of pension systems are protected, whereas healthcare systems are not guaranteed by the state. And then the actuary said that not many entities were considering reopening outside of Michigan because plans have largely stayed open outside of Michigan. And then instead of closing, most plans have added another tier of benefits with a lower cost of benefits through lower multipliers, later retirement eligibility, and other plan designs. And then that being said, Livonia, they did mention Livonia did open for public safety. So shifting on to best practices and strategies guidance provided under the authority of Michigan's Public Act 202 of 2017. I did provide the link so you could take a look at that, but in breaking down the different components of that, it focuses on plan funding, modern plan design, as well as effective administration components. So plan funding, Washtenaw County's retirement plan funding are more than 10% of the general fund operating revenues for pension system. The state guidance is they should be 10% or less. And Washtenaw County's at 18.1% as of the 12/31/24 year end. Washtenaw County's retirement plan funding are less than 12% of general fund operating revenues for retirement healthcare systems at 1.6% because we have a closed plan. And then also the guidance is if all retirement systems across the board should be 22% or less, and we are sitting at 23.7%. So just some considerations for a modern plan design for pension retirement system. Just reopening both systems puts the entire risk and responsibility on the employer and is not recommended under best practices and strategy guidance. It is better to modernize both retirement systems and the considerations outlined on this slide for pension and retirement systems, and the next slide for retiree health care. So just kind of talking about the benefits structure that's offered, and then just modernizing it to evaluate minimum age requirements, the affordability of the plan, implement final average compensation, potentially maybe focus it on base salary rather than including overtime. And then one of the things in the best practice guidance is limit defined benefit options for new hired employees, and then that would include multipliers, cost of living increases, retirement age, and benefit vesting periods. The volatility of healthcare, I mean, we're seeing it across every sector, both whether it's active employees or retiree employees. So just kind of maybe modernizing, and on the industry expert slide, there was a link, couple different things. There was a retiree medical trust that could also, not only could be sponsored by the county, but could also be sponsored by the unions themselves to be able to do something like that. And there's very flexible options today out there for potential consideration. I think we would all need some education on that, but that's the type of thing that we're talking about, is just kind of modernizing it to help contain the cost. Because we've done everything we can for cost containment from an administrative perspective. So I'll go down onto. It's not moving. This slide summarizes the cost containment efforts that have been implemented administratively. Further cost containment efforts will be explored as new ideas and information become available. We're learning new stuff all the time, but will likely have a limited impact, as demonstrated in the presentation. Cost escalations are outpacing any savings obtained, and to have substantial impact will require a benefit structure modification that will need to be negotiated with our union partners. So these are some of the things that we have done. We've we closed the plans, as you know. We've had DC plan effective 1/1/14. We've also evaluated surrounding counties or surrounding organizations for their benefit structure and level. We've also implemented Medicare savings through Medicare Advantage programs, and then enacted mandatory minimum employee contribution levels. So recommendations, the recommendations outlined on this slide are from and reconcile back to the best practice and strategy guidance. So something that we might be able to consider right away that came out of the compensation survey was improved vesting schedules for the defined contribution retirement plan for better alignment with our peer organizations using the results of the compensation study. Due to the economy, cost escalations experienced in the political environment at both the federal and state governments, and the uncertainty of funding impacts from reductions, keep current WERS and VIVA plans closed, obtain the 2025 actuarial evaluation and the experience studies that follow, have a comprehensive consideration of total compensation with valued and prioritized interests for the right wage and benefit structure balance, as the current trajectory of cost is not sustainable. And then after receiving the above, if there's more clarity around the cost escalations and experience, then again, using the best practices to come up and develop a plan structure that is more beneficial and, has a shared risk component, is not all rely on the employer, with continued cost containment, balanced contributions, and cover the costs of funding the new benefit. Request actuarial exhibits for the newly developed retirement and retiree healthcare plan, because we'll have to do that anyways. That's required by state law. And then implement next steps as determined by the board after the above recommendations and information is received. I think, again, the final step prior to implementation of any retirement or pension or retiree healthcare change is to have a full supplemental actuarial analysis that has to be provided to the board before they make a change 7 days prior to adoption. So I included that in the recommendation because that's an important component that we can't miss that piece. Not that Larry would let us miss that if he was aware, but we would have to work through that. So that is my presentation, Chair. I know it's heavy and
Tina,
a lot.
I have to note, it was robust in its density. Thank you for that. We appreciate it. Open it up for, questions from commissioners. Commissioner Hodge.
Thank you, Chair. Thanks, Tina. Robust indeed. Could you bring slide 8 back up? 8, 7, 8, 9. Just 8 though. So this one is just specifically about healthcare for a minute. If we're looking for other ways to try to, I don't know, find other ways to be reasonable with costs, if we're going to consider opening the pension back up, this has always been one that's stuck out at me, in that we have great health insurance, and we heard a lot about that in public comment at a recent meeting. The cost here, would there be a way for employees to end up spending less if we had a different structure than anyone with a 3-person or larger family spending the same amount? And I know it's a great benefit, but that does create, I think, some financial challenges and pushes some of the challenges, I think, on people that have smaller family sizes too. Would that be something we should look into, you think?
Possibly, yes, a modification of the healthcare plan structure, yes.
Do you say more than that?
What can I say?
Any other, like, any suggestions, or like, is there a model you think that would?
Well, that's what we pay Brown and Brown for.
Okay.
So to kind of help, we used to have, our base plan was PPO 2, and it is now PPO 7. So you'll see, on the lower part, PPO 2, the premium sharing is higher than the base plan, the PPO 7. So, but there are some employees that do buy up to that program. We do have to negotiate healthcare, right? Yeah, so it is a negotiated benefit, but there are different structures that we could have Brown and Brown run and then share and then have a discussion with union leadership on, yes.
I would be, I'd be interested in that. And I'd have concerns too about the high deductible plan, because I mean, the cost of the employees on that is really high, particularly. I know you have to reach a certain amount and you have the HSA to offset that. But I wouldn't want to lean more into the high deductible plan. I'd rather look at other options too.
Okay.
Okay, that's all I got for now. Greg is pointing at me and saying something.
Sure.
Chair, Commissioners, I just wanted to make everyone aware that we continue to work with Brown and Brown on cost containment. That is one of the areas that we spend a lot of our time and energy on. And in fact, thank you to the team in HR, Cheyenne and the team. We had Brown and Brown in this afternoon, just so that we had the most recent data, the most current data in advance of this discussion. So we will continue those efforts. But I wanted this board to know that in fact, the entirety of the organization to know that is one of our primary deliverables to all of you, to make sure that we keep those costs contained and that we develop a path forward that makes sense for all of us.
Thanks.
Great. Go to Commissioner Somerville, then Beaman.
Thank you. Tina, thank you for the presentation. I don't know if other people feel this way, but that was really overwhelming, and I might need to have like a one-on-one so I can ask a lot of questions about things. One thing that I was thinking of, you mentioned that you've had conversations about what other organizations are doing at conferences. Have you seen anything at conferences that you've gone to, or other folks that you've talked to that do finance for like counties or cities, where they've allowed an option where people can decide between defined benefit or pension?
The other entities do have that option, yes.
Like it would, and it would
It
be
can
like,
provide that
it would be
option.
something that the employees just
Gets to choose.
decide. Okay, and
Possibly.
then like in those organizations, do you think it's kind of like balanced, like 50-50? Do people lean more into the pension side?
I couldn't not
You
tell
don't
you
know?
intelligently.
I'd just
Never
be
got to that
curious.
specific level.
I'd just be
conversation.
curious, like what the numbers we would be looking at if we opened it back up and we gave people the option, what it would like on the backside, what the numbers would look like.
Yeah, that the actuaries would have to run that report.
Gotcha. Thank you.
Commissioner Scott, you had a comment on that?
I just was gonna address that because when Larry Langer, our actuary, talked to us about that before, he had some cautionary words about that I remember. So I remember thinking what you were thinking about that DBDC. It might have been in times when you weren't there. And one of his concerns was just about how
the unfunded liabilities rise if it's not an all or one thing, because you count on the participation of all employees to be able to fund the defined benefit. And if you split it, you might not have enough to, your unfunded liabilities go up if you allow people to choose.
Go then to Commissioner Beaman.
Okay, thank you, Chair. I got a few, I got a lot, but I wanna keep it to a few for right now for time's sake. I wanna echo Commissioner Hodge, slide 8 for the high deductible plan. I know how high that deductible is because I'm on it. So is my family. And so that really does scare me, especially for our employees on the lower end of the pay scale. So I would really like to not touch that. That's more of a statement. Apologies. Then if we go to cash flow, my favorite, slide 14. A few questions. The first, I'm a little confused about the contributions in the column on the historical cash flows over here on the very right. At the bottom for 2023, it says 18,775,412. And that's, can you tell me what that's made up of?
Yeah, so the employer portion reconciles back to the bottom part
Mhm.
for WERS. In
Mhm.
2023, the employer would have contributed just under 16.1 million.
Yeah.
The difference between that and the 18.8 million would be employee contributions.
Okay,
That is the difference.
okay, that was my question. Thank you.
So that, yeah, that what came from the actuary report. So I just had to pause and think through
Okay.
it. Yes.
Okay, and I mean, thoughts on the cash flow? I'm a finance girl. I don't like negative cash flow. Are we within any comfortable zone here? Because we are never positive in this chart.
So part of that, right, is because it's a closed plan. So
Yes.
we don't bring in the contributions, right, don't cover the benefit payments in
Mhm.
totality. But that is why we have a WERS pension system to fund. And the
Okay.
county, again, contributes the actuarial determined annual contribution that were required, even though it's, and our contributions won't necessarily cover those benefit payments, but over the length of the entire plan. And I think we're at 12 or 13 years of amortization right now with
Mhm.
WERS. One is VIBA and one is WERS, but it's 12 or 13. I can't remember which plan is less, more years that they do the amortization of. But we are fine, and we do have active cash, and we do manage that during our WERS trustee board meetings.
Okay, so we're,
So we are good. Our investment advisor, yes.
okay, all right. It's, the stock market's a beast, so is private equity, but I digress. Looking into the modern plan design, it's slide 21, the second bullet from the bottom. It says require retirees to use their current employer's health benefits or their spouse's health benefits if available. Is that in addition to the county benefit? How would that work?
Well, they have another offering that maybe have a coordinated benefit. Sometimes if you have dual coverage, you have coordinated benefits. And so this is getting outside my realm of things
Yes,
for
okay.
what the structure would be. But that's something to consider for helping to contain our costs of the VIBA plan.
Okay,
It just was a best practice recommendation. So what I did is, if we've implemented the best practice, I tried to stay away from that. If we hadn't implemented it, I tried to include it as a bullet. So that reconciles back to that best practice document. And I
okay.
know that doesn't help answer the question, but
No.
I think it's just a way to contain costs, because we have done everything I think administratively we could do to contain costs.
Okay.
Now we have to do potentially benefit structure modifications to help reduce costs or still contain costs. How's that, if you don't want to outright reduce them? Does
Okay.
that help?
It helps. I'm kind of questioning the legality around this, but I appreciate the background. So thank you.
That all, Commissioner Beaman? Go to Commissioner Robbie.
Thank you, Chair. Where do I start? I guess this is not necessarily for Tina, just maybe for the body. While I appreciate Tina's presentation, I think that this is the type of issue that one can present in various different ways. And I feel like we should probably get a presentation. We heard a lot of cons, and I don't feel like we heard any pros, and I feel like we should get a presentation from somebody that is going to, illustrate a different side of this coin. I think in order for us to make a fair decision, we have to do that. I will say that, at a certain point, the numbers are important. But as I have been working on pensions for 15 years now, I know that there are many different variables that you can adjust in the pension calculation. There's different ways of calculating different things. There's different periods of time that you can amortize over. There's different types of benefits that you can give, different types of calculations for how that benefit is accrued. There's different types of ways to pay into the system that can make the numbers look better or worse depending on how you calculate that. And so I don't want us to sort of like lose the bigger picture here, which is, I think ultimately this is a values question, not a numbers question. We can make the numbers work. It's a matter of, do we want to support our staff in their retirement? And I think that gets back to our values as a body and how we want to compensate our people for the work that they do and the careers that they dedicate to this organization. That all having been said, I do have a couple questions on slide 14, if we could return to that. So the first quick observation that I had is, I know we closed our plan in to new folks in 2013. Is that right?
End of 2013, correct?
Yeah, and so looking at the orange graph, I'm struck by what I see as, okay, clearly prior to the Great Recession, there was, we were at a much different funded level. We were in the 90s and 80s. The Great Recession hit, we dipped low. And the chart has the number recovering as the recession is ending in 2013 and then sort of tapering off at that 70% level. And I note with some interest what that trend line would have looked like had we kept the plan open and whether we would have seen more of a V and less of a inarticulated check mark with a squiggle line next to it. But I think that we don't want to lose in this conversation that we did close the plan and thus people are not paying into it anymore. And thus we, it's different math now because we've lost over a decade of people paying into the pension system. And so as we think about, prospectively looking ahead, I think we need to make sure that we're factoring that in. So my question, I guess that was more of a statement, but my question for you, Tina, is our percent funded, you were saying is different now than it was when we were presented numbers by Larry. Is that?
No, these are Larry's, that's Larry's.
These are Larry's numbers. Oh, I thought you said that it was not as rosy as what Larry had presented to us in terms of maybe it was the healthcare one or no? You're saying that the percentage funded had been reduced or something like that from when we were talking about it earlier?
So in the 90s, it was 100% funded. Then we reopened it and we have never been 100% funded again. And then the last 10 years, this came out of when they did the actuarial valuations. The last 10 years, it's been relatively hovering around the 70% mark. And that's, partly due to a liability experience, salary increases, more retirement benefits than paid, investment experience, returns and contributions that they could cover.
And so the funded percentage for our retiree healthcare is what now? So we're at like,
Our retiree healthcare we're on, you're not on WERS, I was.
so pension, it looks like is about 70, like 70-some%.
Yeah, so VIBA is 93.5%. We dropped from 121.8%
And that was when, 128?
in a year between 23 and 24.
So how did that happen, I wonder?
47 million higher than expected claims and increased costs.
And,
So if you go to slide, Ashley, please, 15, sorry.
yeah,
That UAL for VIBA was 47.4 million higher than expected. That's an actuarial slide. And that's the reasons for, on that, the give and the take. But the heavy part is the claim experience and the cost.
but we're not, so yes. And, typically, when you have these types of pension systems or retiree healthcare systems, they're sort of like supported by the people that are working now too, in some ways, right? I mean, like you have people that are retiring, but you also have people that are in the system and the county's paying in to expect for those people to retire and ultimately have health benefits. So we're in a situation now where we have a ton of people that are retired drawing a benefit, but not a lot of, we're not paying in to cover the people that are at the county now. And so there's just less money in the system. And so we're seeing the numbers go down, even though the market is actually doing okay, relatively. Has been over the last 5 years at least. We had 4 strong years, and then we had a big dip in the economy, and it's slowly recovering, but not at the pace we want it to. But we had 4 strong years, and usually we use 5 years, right? When we're calculating this stuff, or
5-year smoothing.
5-year smoothing, yeah. So, over the last 5 years, the market, I mean, I think, the NASDAQ like doubled, basically, 100% increase from 5 years ago. So I guess like that's it. What we're losing out on by not having more money in the system is we're losing out on the opportunity to invest that money. And so if the market has doubled, you know, or increased 100% in the last 5 years, that's a 100% increase of investment that we've lost out on all the money for the employees that we haven't invested in that fund for. So, you know, I mean, I think in some ways, when we look at this, we have to think about the future, and we have to think about what we're investing today and the volume of money that we can invest to help make sure that we're covering costs into the future and making sure that our system is going to be viable moving forward. Because if you remember our conversations with Larry, the other thing that we noted is that as more and more of our organization goes into retirement and there's less and less people working for the organization that are paying in, the system sort of debalances itself, and the amount that the county has to pay to support that system ends up increasing substantially to support the people that are retiring without anybody paying into the system. So to some degree, like right now, it may seem like, you know, there's 2 sides of the coin to argue. In a few years, it's going to look a lot more like that number that we have to pay in is going to increase substantially because the scale is going to be weighted so heavily towards those that are retiring. So we need to take all that into account as we're considering this. So obviously thinking about the numbers, but I just don't want us to lose sight too of the value here, the values that we hold and the values of wanting to make sure that our employees who have put in a lifetime of service to our organization are fairly compensated in their retirement, and that they have a secure retirement in the end. I mean, the healthcare thing really is, you know, for me, they're both really important, but the healthcare one definitely is big because, you know, our systems nationally do not support our seniors, do not support our retirees in the way that they should. We have Medicare, it's insufficient. And, you know, we're leaving our retirees, you know, out in the cold in a lot of cases. People are spending money out of their own pockets that is putting them out of their homes, that's putting them in a situation where they can't pay for their medical or for their heating bills and so on. And I hate the idea of somebody who's worked their entire life at the county helping people, doing mental health work or doing, you know, working at the drain commissioner's office, water resources, you know, and then retires after a year of years of public service and goes bankrupt because of medical expenses and has nothing left and has to, you know, take drastic actions to just survive. And that's not like an acceptable reality for me as a commissioner to like live in, where, you know, we have to look out for our people who are out there every day on the front lines of this organization, making sure that our public and our community are well served. And those, you know, those people need to have secure retirement. And so let's not lose that value in the numbers. And let's remember too, that like, there's many ways of looking at these numbers. This is a massive system that depends on new people coming into the system. It's just like Social Security. That's how Social Security works. If you don't have new people coming into Social Security, then of course Social Security is going to look like a mess. But it depends on more people coming in, more people paying into the system and making it work. So I just don't want us to forget that in this conversation.
Move then to Commissioner Scott.
To try to remember my question. I mean, this is quite, I don't expect you're gonna know this, but I'm interested. Do we know what the average age of the Washtenaw County worker is? Oh, Guillermo, information at his fingertips. I know. I could sing or something. I put you on the spot. I'm sorry, you can come back. to
Well,
that
I was going to say,
question. Yeah.
why don't we, do you have more questions,
I mean,
Commissioner
I'm
Scott?
just thinking about, I mean, it's just understanding how age of the average age of our workers is raising or lowering our liabilities and how we're front loading obligations or back loading obligations. And, you know, I worry a little bit about where our unfunded liabilities are. Is this right? In 2023, we ended with 121. This is not, do you have the answer? Okay.
42 years old.
42. Okay. We ended with a unfunded actuarial liability in December 23 with 121 million. Am I wrong?
Are you looking at a particular?
I don't
spot?
even know where I wrote that number down from. Did you say it?
I did not say it. I'm
Okay.
sorry. I don't.
Okay. All right.
I
I don't
can't
know
see
where,
the graph.
I don't know where I got that number
need-
from.
yeah.
In any case, I think that this is obviously not an easy question. There's so many questions I have about hard caps, and I'm really concerned about medical costs for retirees. That's one of my biggest concerns. I know the pension is foremost in people's mind, but I think it's important to recognize that there's two issues at play here. There's retiree medical costs, which is one issue, and the pension is another. And so thinking about them, I think we're conflating the two issues a lot when we're talking about them at this board table. I'm really concerned about how people continue to afford healthcare after they're retired, knowing that healthcare costs are the biggest reason people go bankrupt. I hate to think about somebody working for this county for their whole life and then going bankrupt over healthcare costs. So, but by the same token, that is the most volatile part of cost in terms of retiree healthcare. But I'm so much more concerned about that than the difference between DB and DC. A lot to talk about. I'm glad we're talking about them at the table, having a public conversation about it. There are a lot of employees paying attention to this conversation, but I think as Commissioner Sanders has said before, when we've talked about this in the past, this is also a Washtenaw County resident issue too, because this is all taxpayer money. So I hope a lot of people are paying attention and thinking about what they'd like to see their government taxpayer money going to do for people who work for this county, and letting us know their opinions about that also. And then obviously not the last time we'll talk about it. Wow, thanks for the super snapshot presentation, Tina. I can't imagine how difficult it was to put together this presentation. and how difficult it's gonna be to continue talking about it. So thank you very much. And we'll keep going and keep trying to understand more. But thank you so much.
Go to Commissioner Light.
Thank you, Tina, for your hard work for the presentation. And as Commissioner Robbie said, we just want to make sure that we're, making sure we have all of our options and that, you know, seeing all of the pros and all of the cons. Along with that, for me, I just want to ask, with the climate of our economy, is this the most appropriate time, right now for us to begin, working on this rim of the pensions and benefits of that sort? Because we have not heard from the clown house of what the budget is gonna be and how it's gonna be. And I just don't wanna wake up and we're trying to figure out how not to lose employees. And we are working on pensions and then we might end up losing employees. And so I just wanna know, is this the most appropriate time? Would it be out of order for us to, I don't wanna put it on the back burner, but I wanna be, I wanna think realistically about what we have to, you know, how we have to worry about our budgets. Like I said, coming from the clown house, is this gonna, you know, is this the most appropriate time? So that's the first question.
So yeah, bullet number 5 on the recommendation side just kind of outlines, you know, until we have a better idea of the economy, the political and the financial impacts of the state and federal government political environment. You know, I think we should get additional information. Actuarial report for 2025, and then the experience study that's required every 5 years, which happens after 2025. And then hopefully by then, you know, we're talking 18 months potentially, we'll have a better idea on the economic and the political impacts and financial impacts of those decisions. So I know that wasn't a direct answer, because
Mhm.
it's for you guys all to decide, but
Yeah.
I think more information should be provided for the consideration.
Because I'm just thinking, you know, even if we do continue to work on this, if we can just have the what ifs, what if, you know, what if the budget looks like now? Should we draw that in now while we're having these discussions so we can see what this may bring about, where it may put the county with our budgets if we do reopen, just if we can incorporate the what ifs with the budget legislatively, like how will that affect?
So the first thing.
Can I just make a point of privilege, please? The people in the hallway can't hear many of us apparently because we're not speaking close enough to our microphone. So that's why I wanted to
Got
make
it.
that point of privilege. Thank you.
Okay,
So I think the first step is, if there's further consideration, we need to get updated exhibits based on the 12/31/24 actuary report from the actuaries. That's the first thing for consideration before we can start even building anything in a recommended budget one way or another.
and then, thank you. My next question is, has there been like recent surveys and town halls within our unions to make sure that we have the input from our employees on what they want directly? For me, I would like to have participation from as many as possible, you know, the majority, like 95%, so that what they want influences what is done. And to me, that's the most important, is what our employees want. And, you know, because they know what they need. And so I would just like that to be considered, for us to have surveys and for there to be discussions with our employees so they can represent their own decisions. It can be brought to the table, because I think that this is something that is very important, and I want them to have what they need. So I'm in agreement to whatever the employees want.
So there was a survey done. HR provided the results. I mean, that doesn't mean we can't do another survey, but there was one that was, the results were shared.
I would just like a little more in it, because I seen, the results, and I would just, a little more participation, a little more direct communication with our employees. Just for more, because this is not, it's like a kind of an ongoing process, and for it to be up to date and current, information from our employees.
Got it.
Okay, before I go back to Commissioner Robbie, anybody who hasn't had a chance to ask a question that has any interest in doing that? Commissioner Robbie?
Thank you, Chair. I just wanted to note and thank our labor partners for submitting at our last meeting a binder of signatures from employees that were supportive of reopening the pension and retiree health care plans. I believe there was close to 800 or maybe over 800 folks that signed it. And I mean, that's pretty much half the organization. And I know that there were a mix of people from various parts of the organization, various age demographics, so there's a pretty broad cross-section of people that I think want this. To me, that speaks volumes about, the desire of our employees to have this. I personally haven't heard from anybody that's been opposed to this that has said, don't do this. If you're out there, reach out. I'd love to hear from you. But I so far haven't really heard that reaction. I also want to note the volume of speakers that we had at our last meeting, and I anticipate that we'll have again today, speaking about the need to reopen the pension and retiree healthcare systems directly from our frontline employees and union leadership, to do that. So I have appreciated the feedback that we've gotten in support, and it's been pretty consistent, timely, and current. Thank you.
My own thoughts are, I'm still pretty open on the pension option. I think there's a lot of data post-pandemic about the retention benefits of a pension. I think back to some of the darkest days of the pandemic at the onset, particularly 20 and 21. And I know we had high-level staff that stayed here in large part because they sort of saw that at the end of the rainbow, if you will. And so there's a value there that may not be easily put on a spreadsheet on an annual basis, but institutional knowledge has both a cost to develop and a value to maintain. I'm far more scared of the concept around healthcare because of the pace of change and the unpredictability of cost in healthcare broadly. That I don't see that changing. I think if anything, it's going to speed up. It is important to note we closed the pension for new hirees in 2013 at the same time that we were having a discussion at this table about the concept of bonding to cover our unfunded liabilities. And I think that's relevant just because, to be totally honest, those two considerations couldn't be disconnected from the other. I see no solutions here. I see trade-offs either way, maintaining a closed system or reopening. But I'm glad we're having the discussion. And I think, if we can continue to get data, get as much what-if scenarios as possible, we'll come to the right decision. But I really appreciate it, Tina, because keep in mind, you were asked to present on this 13 days ago. So it was just sort of, no, forgive me, 9 days ago. So thank you for marshaling this data and bringing it to us. Commissioner Robbie.
I'm sorry, just one more thing I just want to throw into the conversation, which is as we think about the cost of this, I want us to remember that the cost is going to be negotiated at the bargaining table because all the different factors that go into the pension are negotiated at the bargaining table. The benefit, all of that is negotiated. And so we won't know what the cost is until we go through that process. And that, again, there's a give and take there between both sides. So I just wanted to make sure to put that out in the universe as well.
I think that's an articulate way that echoes my point about no solutions, just trade-offs. Depending on what we put in on the front end, it's gonna change the back end numbers, and is a good reminder of the one good thing about this discussion is we have some control over it, which is in today's time and world, a precious thing. Any other final questions for Tina? Again, we will have this on future working session agendas as a discussion item. Okay. Tina, thank you. Please take a break or whatever you need to do. Any items now, moving to number 6, any items for current or future discussion? Okay, before we adjourn, Chair, what time do you want us to recongregate?
15 minutes from now.
So at 19:37. 19:37, also known as 7:37. Okay? Hey, wait. We are adjourned.
Okay, hi, good evening, everyone. I'd like to welcome you to September 17th, 2025's Washtenaw County Board of Commissioners meeting. We are adjourning this meeting at 1941. Sorry, I was late. First thing we do is rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thanks, everyone. We have a new clerk helping us tonight, Brendan. Brendan, not Brandon, Brendan.
Yep.
Brendan, welcome.
Thank you.
I'm going to ask you to do your official first job at our board meeting. Call the roll.
Thank you.
Thanks.
Commissioner Beaman,
Present.
Commissioner Hodge.
Here.
Commissioner Labar,
Here.
Commissioner Light. Commissioner Machieski,
Here.
Commissioner Robbie. Commissioner Sanders. Commissioner Scott,
Here.
Commissioner Somerville.
Here.
Thanks so much. Before we move on to public participation, we are going to do a resolution to honor the dental clinic. You know, and I realized I didn't ask what commissioner wanted to do this. So I think I'm just gonna pull one out of my hat. I was gonna say me, but I do not always have to be in the spotlight. I'm gonna ask my colleague, Commissioner Hodge, who's also on the Public Health Board with me well, all right. Hello, welcome from another angle. This is a resolution honoring the 10th anniversary of the Washtenaw County Dental Clinic. Regardless of how you feel about the dentist or dental care, the dental clinic is really elemental for your health. And I just want to say before I read the resolution, as a cardiac nurse, bingo, your oral health has a direct impact on your cardiovascular health. See all the dental clinic people nodding behind me. So don't think it's just about your shiny teeth and no plaque and tartar and cavities. You actually can impact your cardiac health and your valve health too. So let me tell you, whereas local health departments in Michigan are governmental entities with a legal responsibility to assure the public's health, and oral health is crucial for overall health, including physical, mental, and social well-being. And whereas Washtenaw County Health Department and partners documented disproportionate oral health issues among lower income adults and children in Washtenaw County, as well as a shortage of dental providers willing to accept Medicaid coverage, leaving many residents unable to afford dental health services. And whereas Washtenaw County Health Department established a new dental clinic in partnership with My Community Dental Centers, Trinity Health Ann Arbor, Washtenaw County, and the Washtenaw Health Project, and the celebrated opening of the Washtenaw County Dental Clinic in 2015 at the Hobb Health Building in downtown Ypsilanti. And whereas the Washtenaw County Dental Clinic is operated by My Community Dental Centers and is served and continues to serve adults and children with Medicaid dental coverage or no dental coverage. And whereas the Washtenaw County Dental Clinic serves approximately 3,000 patients per year with about 7,000 dental visits. Holy moly, that's a lot of dental visits. And the Washtenaw County Dental Fund currently provides direct support to 370 patients, access to dental care. And whereas the Washtenaw County Board of Health recognized and celebrated the 10th anniversary of the Washtenaw County Dental Clinic with a resolution on July 25th, 2025, and is grateful for the support and commitment of the collaborating partners and the resulting improvements in oral health through improved access to dental health services in Ypsilanti and throughout Washtenaw County. Now therefore be it resolved that the Washtenaw County Board of Commissioners is pleased to recognize and celebrate the 10th anniversary of the Washtenaw County Dental Clinic, and be it further resolved that the Board of Commissioners also recognizes and thanks the Health Department and collaborating partners for the significant improvements in oral health through improved access to dental health services in Ypsilanti and throughout Washtenaw County. Anybody want to say anything? You're welcome. You don't have to. Don't feel obligated, but the microphone is yours. Okay.
Start real quick. Good evening, Commissioners. Thank you so much. I think it's wonderful to celebrate this collaborative partnership that has existed over the past 10 years and even before that in the planning of the dental clinic, really working together to ensure that our residents, particularly low-income adults and children, have access to dental care. And I just really want to thank our partners for being here tonight. Kelly Stupple from the Washtenaw Health Project, Kim Singh from My Community Dental Centers, and Lacey Sapkowitz from Trinity Health, who, by the way, is here on her birthday. So I'd invite them to say a few words if they would like. Thank you so much.
Hi, I'm Kelly Stupple from the Washtenaw Health Project, and I would like to thank you for the opportunity that you've given us to provide free dental care to folks through the Washtenaw County Dental Fund. We gave the data a month or two ago, and at that time it was 370 people for this year. We are now about 50 more people than that. We're about 420 at this point. So we're very excited to continue to do that. We'll keep enrolling people for this year and next year. And we thank you very much for the opportunity.
Hi, everyone. On behalf of Trinity Health Ann Arbor, thank you again so much for honoring and recognizing this work. You know, working with our community partners is core to our mission, and so we so appreciate this opportunity to collaborate with our partners.
Good evening, and I would echo, My Community Dental Centers also considers this an honor and a privilege to partner with the Health Department in Trinity, and we are pleased to be able to impact access to oral health care. So thank you very much.
All right, I'm just gonna say thank you, everyone, and instead of making everybody sing, because Lacey is giving me a thing, saying don't do it, I was gonna sing, but just happy birthday. Thank you very much. I'm respecting your wishes. Thank you. Thanks.
Thank you, Chair. I just wanted to quickly say something about the dental clinic too. I want to thank, I know that obviously the folks that were here today have done an immense amount of work in the dental clinic in its current form. The dental clinic was something that I worked on when I was chair of the board in 2013 and 2014. We created the framework for it, and it came into being the year after when Felicia Brabeck was our chair in 2015. But at the time we had Dick Fleece was our public health director, and then Ellen Rabinowitz. And the two of them really worked really hard on this. And so I just want to give them a shout out in this moment too, and all the staff at Public Health at the time as well, who really helped to make this a reality, and all the community partners that came together to make it work. So it's crazy to think that this has been 10 years now, but it's amazing to see our community well served by such an incredible program that we built all those years ago.
Does anybody else want to say anything about the dental clinic now? Okay, great. It's, you know, obviously dental health is more than just a pretty smile. At this time, it is public participation for the meeting. You can come forward to our podium. You have 3 minutes to speak. There's a series of lights that will tell you about your time. Green means go, yellow means wrap it up. Your time is ending, and when it's red and blinking red, your time is up. And I will unfortunately interrupt you just as a method to keep things fair across the playing field for everyone. When you come up to the podium, if you could introduce yourself and tell us a city or township in which you reside, and welcome to the meeting. We're glad you're here.
Hello, my name's Tammy Bruno. I'm from Saline Township. I talked at your last meeting too about the data center. Data centers are slowly taking over Washtenaw County. If we're not careful, every township with open land could soon become home to one, changing the character and the communities and placing enormous pressure on our resources. I'm grateful for the resolution you're planning to discuss or pass later to act on the serious public health, the energy, the water, and the climate concerns tied to these developments. It's a meaningful step forward, so thank you. That shows that our voices, the community's voices, are starting to be heard. We're moving in a better direction. The resolution directing county staff to develop outreach materials and urging municipalities to adopt strong approval standards is a sign of the growing transparency and accountability. But I feel like we need to go a little bit further. We need independent third-party oversight. Local townships deserve reliable, unbiased information that helps them with informed decisions. They can only come from trusted external sources, not from the companies seeking the approval. And here's the hard truth. How is my rural township supposed to fight a billion-dollar corporation? Our board voted against rezoning based on our master plan and our community input. But now what? Now we wait for the other shoe to drop. Will they appeal to our zoning board when our residents can't attend the meeting? Will they sue our township? Use legal intimidation to just wear us down? I'm not a legal expert by any means, and I don't know all the tactics they might use, but I do know this. We need to stand together, we need to stay engaged, and we need oversight. Let's keep pushing for responsible growth and protect the future of Washtenaw County. Thank you.
Thank you.
Good evening. My name is Dr. Lauren Sargent. I'm a 41-year resident of Ann Arbor in Washtenaw County, and I'm also speaking in favor of this resolution. I'm a co-founder of Washtenaw 350, and I sit on the Washtenaw County Environmental Council. And as a household, we have done everything in our power to electrify everything and power it with renewables and efficiency, but that's a drop in the bucket. Households and individuals require support. We have to have systemic, universal action. And these data centers will completely blow up our county environmental and climate goals and the city of Ann Arbor goals, et cetera. And I think you know that. So what I'm asking for you to do is to, yes, support this resolution and then do much more. Educate yourselves. This is an arms race in AI mostly. And it's destroying not just our environment, it's also destroying the job prospects of students who are just trying to enter the job market for the first time. I'm a retired clinical psychologist. There is a massive suicide and depression epidemic among our young people who've given up hope. Please support this and then some, and give these kids some hope. I should say young people, not kids. So please, we can and must do better here. Thank you.
Hello there. Can you hear me? Yeah. Okay. Hi there, Andrea Pierce. I'm an Ypsilanti Township resident. I'm with Michigan Environmental Justice Coalition, and I'm also on the Washtenaw Environmental Council. I'm Protect the Water. So I wanted to start out by saying data centers are a lie. They have been lying to us. They say they're going to bring in all this money, but if you read about them and learn about it, they don't. They have not brought in money to all over the United States. States are like West Virginia are saying that we don't want them here anymore. Get them out of here. They're trying to cut the deals because they didn't work. We have in Washtenaw, we have resilient Washtenaw goals, and that data centers will negatively impact. We will not reach any of our climate goals if we allow data centers all over Washtenaw, which is what has been going on. Ypsilanti's getting, what, 2 of them, I believe? How can we sustain that? We're looking at high electricity costs, and with this bad infrastructure that we have here, the only ones that are going to benefit is DTE. They're the only ones that are going to win. They're going to get so much money. And from what I've been reading, the migration from the birds, from the shaking and the vibration, the constant shaking and vibration that happens within a 3-mile radius, means that the birds and the animals will not migrate here anymore. So what we're looking at is not hearing birds chirping, which may not seem like much to you, but it seems like a lot to me. I like to hear the birds. They give me hope. So I'm going to ask that you support the data center resolution, as they do not benefit Michigan or Washtenaw. It's all lies. We do not benefit. And I was reading in the Saline Post, they actually did an article where they said flat out that the monies that were supposed to be coming in from the data centers are a lie for the schools. I think it was some $8 million, I believe it was. They said it was a lie, Saline Post. So anybody and Saline's looking at data centers, trying to, they're fighting it. So support us, please. We need help out here fighting everything, all this crap that's coming our way. Ypsilanti Township, my township's afraid we can't get rid of it. It's U of M and Los Alamos. They got more money than Zeus at this point. So we need help. Thank you.
Thank you.
Good evening, Commissioners. Michelle Dietrich at Superior Township. It's very good to be back in this chamber where so much crucial work is done. Thank you for your service and the opportunity to speak. I'm Michelle Dietrich, Chair at the county's Environmental Council, a former commissioner. I work on environmental, artificial intelligence, and labor issues at both the local and the national levels in my capacities as Vice President of the Area Labor Federation, as Chair of the National Democratic Party's Environmental Council, and on national advisory boards. And first, quickly, I am fully in support and grateful for your reopening the question of pensions and retirement benefits. Thank you. But I'm mostly here to, like others, to ask that you support a resolution which was developed and approved unanimously by the Washtenaw County Environmental Council. The resolution, as others have said, authorizes and directs Washtenaw County staff to develop informational materials on data centers for local municipalities to assist and support their due diligence when they have rezoning requests or are doing site plan reviews. It recommends that they require developers to be transparent about the issues that we have seen as being problematic all over this country. Water usage, energy use and sources, air pollution, noise, low frequency vibrations through the ground, electricity rate impacts for tax ratepayers, and public disclosure and input. Washtenaw County, what's happening here, it's a microcosm of what's happening nationally. Global power demand from data centers is projected to rise, it doesn't sound believable, but it's 50% by 2027 and up to 165% by 2030. Michigan already has 49 of them. 4 have been proposed in the county. And for an idea of scale, the 2 side-by-side data centers that are proposed for Ypsilanti Township would, if built out as described by the Michigan Economic Development Corporation, require 110 megawatts of energy to power them. That's nearly 4 times the total power used by the more than 24,000 households in Ypsi Township. AI data centers' soaring electricity demand is driving the development of over 10,800 megawatts of new fossil fuel capacity as of early this year. It's already happened. It's huge. That's enough for like several mid-sized cities, and it's going in the wrong direction. And when we look at climate emissions, it's making our air dirtier, more dangerous. Training a single AI model can match the pollution of 10,000 cross-country trips. That's just incredible. With emissions that pose, where they pose the most danger, those emissions, where they make it dirtiest, it's the low income areas. It disproportionately impacts Black, Brown, Indigenous, and poor white neighborhoods. By 2030, AI-driven data centers could cause 1,300 premature deaths annually and 20 billion in US health costs from cancers, asthma, lost productivity. So I'm just going to really quickly, I've got 11 seconds. In Virginia, electricity rates have risen nearly 25% as a result of them being the data center hotspot of the country. And there's the major water issues. I hope that you will approve this resolution. Thank you for considering. I have to run another Zoom meeting, but hopefully you all have my phone number. I'm glad to get on the phone with you and talk. Thank you.
Thank you.
Hello, my name is Kelly Coleman. I am from Saline Township. I want to thank you all for being here and listening to our concerns. I also am here to discuss the data centers that have been proposed. I live personally off of a well in Saline Township. The data centers are proposing to dig wells that are significantly deeper than our residential wells. And we are very concerned about the aquifers and losing water for our homes. The data centers have no regulation in how they actually report and how much water they actually use. So they could use, say, 20,000 gallons a day, but it could be significantly more. We won't know. I do encourage you guys to go forward with this resolution so that we can have some definite oversight and some over these specific projects so that myself, my neighbors, and all of you who live in Washtenaw County can continue to rely on public water and private water. Thank you.
Okay, my name is Bill Bray. I'm from Washtenaw County, Manchester Township. I'm a Marine from the Vietnam War. I'm a ex-fireman for Ford Motor Company, and now I'm a beekeeper. We do bee talks for kids. We got an award last year for doing over 50 presentations for kids. That's not what I'm here for. I'm here for blight in our neighborhood. There's areas that there's over 15 to 20 junk cars, junk gas cans, and they do have kids there. So being a fireman, I'm very leery of fires. There's probably a line of 6 houses in a row. And if one of them caught on fire, they would all go because it's on a lake. There's no fire protection, no water hydrants. The water would have to be brought in and they would all go. So I'm thinking of the protection of the kids and the neighborhood too. But the blight, it has been on the files since 1989. There's been complaints about it. Originally started from the grandfather. He passed away. They passed it on to a grandson, and he's carried on the tradition. And some of the cars come, stay overnight, get torn apart, and then they leave again. So I'm not going to say any more my opinion on that because I don't want to get into that. But the blight is terrible. I'm worried about the kids, the neighborhoods. If it ever catches on fire, the whole neighborhood's going to go. And that's all I would like to. And it's been brought to the attention of the township. And for almost 3 years, we've been trying to get it resolved. And so far, they make them clean it up a little bit, but nothing is going to stick. Okay, thank you very much.
Thank you. Good evening, Commissioners. My name's Mary Campbell. I work for Washtenaw County Government for the IT Department. I am the president of AFSCME's Local 2733. First thing I want to address is I want to again say this meeting on record. Thank you for bringing or putting on your agenda the discussion and the presentation about the possibility of reopening the county pension for long-term employees that were hired after January 1st, 2014, and the retiree health care. I can't say it enough. Thank you very much for considering it and, putting it on the agenda. I would like to address one other item after sitting through the previous meeting is about the pension. The petition that was brought forth and presented to the Board of Commissioners. There were 856 county employees that signed that petition that are in favor of reopen, whether they're on the, whether they're already going to receive a pension and retiree health care when they do retire or whether they don't. And if there were 856 employees that had signed that petition stating they didn't want to do this, that would be a huge thing. So the fact that we have 856 employees signing it that are saying they would like the commissioners to please sit down and seriously consider this. Think about what the Washtenaw County employees would like you to do. two, to be able to retire with dignity. And so it's just one of those things. Again, I can't say enough, just thank you for listening to us. But please take into serious consideration that we're talking 2/3 of the county employees that did sign that petition that are telling you they want this. Thank you. Thank you, everybody.
Anyone else in the room for public? Worse. Hello, friend.
Hello, my name is Tim Olson and I am an Ann Arbor, Washtenaw County resident. If you guys forgive me, I did not expect to say anything, so I don't have any prepared remarks. But I would say that it was incredibly frustrating for the labor coalition that was here tonight to hear that somehow the voices of the employees was not sufficient. The labor coalition of Washtenaw County has approached the county 4 different ways to express the overwhelming desire of employees at Washtenaw County to come to the table to negotiate to reopen the pension plan and the retiree health care plan. The unions came together and asked to bargain at a common table for everybody to come up with one deal to open these plans. There was a survey that was put together in collaboration with the entire labor coalition where we helped to curate the questions. And in that survey, more than 750 employees filled it out, and more than 86% of those employees said that they wanted those benefits. In response to that, we were told that that wasn't a representation of the size of the employee population, and that there were questions about what demographic of whether they were in the retiree benefits or not, those were. And so we brought to you 2 weeks ago the binders filled with over 850 signatures of Washtenaw County employees and indicated which of those employees were in the WERS, were in the VEBA, and were not. It's frustrating tonight to now hear that that also does not seem to be enough to show an ample representation of the will of the county employees. And I have to implore the board to give some type of feedback to us about what is enough for us to convince you that this is what your workers want. Politics is how we show each other we care. That is not a statement that I say to have value towards left or right. That statement is a choice that is in front of us every single day. It's a choice that we make when we vote at the ballot box. It's a choice that we make when we choose or not to choose to help our neighbors. It's a choice that you all make every time you guys vote to implement something here and to put forth a plan to help the community that your workers implement for you. I would implore all of you guys to consider that choice and what it means. Politics is how we show each other we care. I am imploring you to show your workers how much you care for their well-being when their time here is over. Thank you.
Thank you.
Good evening.
Hi.
Jeremy Haley, Ipsy Township. There's gonna be some rehab in my future on things from the accident, so awesome. What I'd like to talk about is what is unrealized gain? And most people don't know what that is. It's when you buy a stock for 10, it goes up to 100, but you still hold it. Yes, you gain something, but it's not realized until you cash that out. And then it's realized, and you have to pay tax on it. One of the top reasons why people lose their homes after first buying them is property taxes. I forgot to bring in my little property tax receipt where it said reason for adjustment is market adjustment. Okay, I'll get back to that. There's a guy in Texas called Mitch Vexler. He's a real estate developer. He's done these cases, or he's filed a case in the district court. It got kicked to the appellate court, and now it's in the Texas Supreme Court. And basically, property tax is is a tax of unrealized gains. Because somebody assesses your property for a value, just no different than any kind of stock, really. And you're actually taxed on it. And he's suing his county on the 16th Amendment of direct taxes. And if you go to mockingbirdproperties.com/DCAD, you'll find all the documents that he's shown and proven quantitatively that the governments have been using the assessor's office to raise the housing prices to produce income for the government, municipalities. Reason why I can say this, anybody recall Farmer Grants in Jackson Road just past the Ebe? Scioto Township? While they were still in business, late in business, Scioto Township's assessor's office assessed all their land, farmland, as if it had had a house on each one. They did that to jack up the prices so they couldn't afford the land, force them to sell for development. The Grants took them to court and they won. The judge said, you can't raise them that much, but he still kept them high enough where they eventually had to sell the property and sell out. So yes, I do know for a fact that governments do use property taxes and assessments to get money for the municipalities and for development. And I just urge you to look into this because property taxes may come to an end if this goes to the Supreme Court and they have to rule on the 16th Amendment direct taxes because property taxes are an unrealized gain tax on people. If you want to keep older people in their homes, drop the property taxes. Thank you.
Thank you. Anyone else in the room for public comment? Ashley, anyone online for public comment?
There's no one online, Chair.
Okay. Commissioner follow-up to public comment. Commissioner Robbie.
Yeah, thank you. So first of all, I want to thank everybody who came and spoke today. Really powerful testimony from members of the public. Just to start on the data center thing, obviously I'm going to support the resolution today and very supportive of all the comments that were made. You know, I think this is, I've said this before, but we're in a time of multifaceted corporate attack on our environment in this county. We heard some of that at our last meeting as well with the gravel mine, with these data centers. There's talk of landfill expansion. There's biodigester happening in Freedom Township. And this is a problem that we're gonna have to contend with as a community. You know, we have valuable natural resources here. We have valuable water, temperate climate, and clean air. And of course, corporate America wants to access those things. And all of the organizing that happened in Saline Township, I want to applaud the residents for organizing and for having their voices heard, and the township board for making what I believe is the right decision. And but I do want to say for the activist township residents that are here and others, oftentimes when you get a win like that, it can feel good, and you can let your guard down. And love that you guys are here because you're not doing that. But I just want to say the strategy that these corporations use is they wait till people aren't paying attention and they sneak attack later on. And so stay tuned in. You know, watch what's happening at your local bodies. Watch what's happening here. You know, democracy works best when people are paying attention and when people are showing up and when people are speaking at these meetings and just reminding us these are the issues we care about. Please be vigilant. So don't give up. And you know, keep the pressure on because what you're doing is working, and I hope it works in other parts of the county too. I know Ypsi Township is now pushing to relocate the U of M data center that's being proposed there. You know, I think again, it's still going to impact our water, it's still going to impact our air, regardless of whether it's located. You know, and it's still going to impact our grid and our energy systems, our ability to meet our renewable energy goals. It's still going to impact our environment, our quality of life. You know, as we've said time and time again, and we've seen across the state, I mean, there's so many examples of, you know, jobs promised and jobs delivered. And we see it for economic development projects of all kinds, but we've specifically seen it with these data centers that they do not result in the jobs promised, and typically don't result in the economic investment promised, and just leave our communities holding the bag on the environmental costs and the electrical costs of building them. So want to thank the Environmental Council for organizing this resolution, for the Environmental Council members that showed up, for the members of the public that came from your respective communities to advocate for this resolution. I do want to just say, I agree that I don't think this resolution goes far enough. It's a first step, but I think we could do more as a county. I wish that we could ban data centers outright in our community and not have them be located in our county whatsoever. Obviously, it's a local zoning and control issue, so we can't necessarily do that at this table. I wish we could, but that, you know, we can always make these resolutions stronger. I think this one is, you know, very articulate, well-reasoned, and it creates, you know, resources for our communities as they face these multi-billion-dollar companies that are coming in with well-resourced and well-heeled, you know, attorneys. It is a daunting task to go up against those types of companies. And so bravo to the citizens that have had the bravery to do that. It is really commendable. I've already shared my thoughts on the pension, basically, but I just want to state unequivocally that I support the full reopening of our pension and our retiree healthcare. And again, this comes down to a matter of values. It comes down to a matter of, we need to make sure that we're taking care of our workers and that have dedicated their lives to this organization. And we can make the math work. We have made the math work in the past. We can make the math work again. It is not a matter to me of numbers. It's a matter of values. And that's really what we're looking at today. So just want to thank everybody. I do want to say on the property tax question, I wish that we could be less reliant on property taxes. And I wish the state would give us other taxing authority to be able to have taxes that are more evenly distributed and that are less burdensome to people staying in their homes. And that's something that needs to change at the state level. It's something that I've long advocated for and others have as well. But it is unfortunate that counties and municipalities are so heavily reliant on property taxes as really the only way to raise revenue for our ability to provide any services in our community. So, but I think we all need to be advocating for that to change, and I certainly will continue that work. Thank you, Chair.
Thank you, Commissioner Robbie. Next, I have Commissioner Light.
Thank you to everyone who had comments this evening. I first want to just speak about our data centers. For me, I would love for us to have more information, for them to come and to present and give us the real information about the data centers and just tell us the truth. And, you know, and as far as with U of M, it's like we're strapped, we can't do anything. However, we can. For one, you can continue to fight like you've been doing, and to continue to advocate for our environment. Push our local municipalities to come up with ordinances and policies that, for example, where these data centers, they have to pay in to keep our electricity rates at an all-time low for maybe 20+ years, and that they have to guarantee that you want to build these data centers, you have to be here for 20 or plus years or more, where they have to make sure that our wells and our water is not contaminated, and it has to stay you know, clean and at the levels that it's supposed to be, and guarantee that since you have a data center and you're using all the electricity, that we won't have any power outages in Washtenaw County. So with that, we just have to push, we have to strategize, and we have to push our municipalities to think of ways, since they want to come here and we can't put our hands on it, but we can put our hands on it by making them struggle and by giving them so many things like, oh my gosh, we don't even want to be here because they have so many ordinances and policies and this and that they don't want it. And so that's one of the things that right off the bat that I can think of, and I'm willing to sit down and try to strategize and to try to advocate so that we can make that happen. So that's that. The next thing that I wanted to just kind of make clear, I am all for whatever our employees want to do as far as with pensions and anything of that sort. I want to be clear with that. I am not saying that we don't have enough information. I just want to make sure that we stay on top of it, that we are always current, that we are always making sure that their voices are heard. I didn't say that it wasn't. I've reviewed the surveys, I've reviewed the signatures, but I also have had people coming to me and saying other things. So I just want to make sure that the communications and the information that is just continuing to be present as we go along with this. I do not believe that politics, I believe politics is messy. I don't think it's the best example of showing how we care. It's real messy, and a lot of things are becoming political, and it shouldn't. Like your future and your healthcare, it should not be political. It should be all about making sure that you get the needs and the necessities to live into after you retire. So politics is messy. It's nasty. I mean, we're here. So I just don't want to get anyone to be conceived that I am not for reopening, for pensions. That's not what it is. But I want to be clear that we need to make sure that we have what the employees want. It's not for those that already have pensions or those that may, need a deeper understanding or want to have these talks. So let's just keep it open. We've been having these communications. There's nothing wrong with that by communicating and making sure. But see, everybody's blood will be on our hands if we don't do this correctly. So I'm with whatever our employees want, but what I won't do is be perceived as if I don't want it. I want whatever our employees want.
Thank you, Commissioner. Commissioner Somerville?
Thank you. Okay. On the data center resolution, I supported that. I serve on the environmental council. And I just want to point out, for all of us, group activity as human beings, these things that we use are part of the reason why data centers are popping up all over the country. And all the apps that we use and all the social media accounts that we use. I regularly dream about the internet just not existing anymore because I think it's really ruining the entire planet. And so I just, I think it's really important that we speak out in the areas that these are starting to pop up at. Obviously, the situation where a public university purchased land and is opening one is a little bit different because they have a lot of authority under state law to forego any local control that other municipal governments have. But I just want to just remind people that we unfortunately are all participating in like this growth of AI. And I think AI is an okay tool, but I try to consistently push back on using AI in my personal life just because I think I'm a firm believer that we have to continue to use our brains and think creatively. And I'm really worried about young people who are being forced into this AI world very early on. But so I'm just encouraging all of us, like in addition to supporting this resolution, think about how we're influencing our family members, especially young family members, and pushing them into this world of AI as well, because that's part of the reason why these are all popping up all over the place. But thank you for all your advocacy. I think it's really important. On the pension issue, I'm super supportive. I think we should reopen it. I also think that I've talked to a few non-union employees who prefer to stay how things are going right now for them. And I think that I haven't been there was a period of time where I was not part of conversations about this for health reasons. And so I don't really know. But I'm convinced that we could reopen the pension for the union employees and still allow our non-union employees to have stay how they are, make the decision. And then I guess I would be interested in taking a deeper look at what Wayne County government has recently done because I believe they reopened their pension, and I'd be curious if we can get some data from them on how many
if it was a difference between union employees versus non-union employees, like, did they just open it up for the union employees and did the non-union just stay on the plans that they were on? So like, I think we should continue the conversation. I think also we have to, right? Because it's written in the contracts. And then to the gentleman from Manchester, thank you for your service. Yeah. All done.
Thank you. Commissioner Beaman?
Thank you, Chair. Thank you, Bill, also for your service. And I know we've emailed back and forth, and I'll try to do what I can to support the issues within the township in regards to that property. So thank you for coming forward with that. And I apologize for the issues that you continue to face with this property for decades now. I also want to support our employees, and I just want everyone to know that as we continue to explore these options, we're proceeding with careful consideration because we do care. It's not to prolong a process, it's not to draw things out, but you truly are the backbone of our work. I am the one that says we don't make widgets, you do our work. And I deeply respect all that you do for our county and the decisions going to be made by our commitment to long-term well-being, financial security, all of these different things that we want for you. But we also need to make sure that the path we choose is sustainable and responsible. So as we have these continued conversations, that's why we want to make sure that we're taking the best steps forward. So thank you for being here. Thank you for sharing your voices. Please continue to do so. You are what we are in Washtenaw County. You truly are. In terms of the data centers, I was at our Saline Township meeting last week. I was in the back. I let all of the residents speak as I do because it's your voices and it's your community. But as the commissioner representing one of the largest rural communities in Washtenaw County, I have to speak up about what we're seeing, which is large corporations trying to slide massive projects, industrial projects into our quiet rural townships under the assumption that we're a soft touch. There are other areas that have great industrial spaces that are vacant where they could place these centers, and they're not because they are more restrictive. There are rules, there are guidelines, there are barriers in place that these billion-dollar corporations have to jump through these hoops. And in the townships, because we haven't seen this before, these are brand new, and the industrialization of our rural areas continues to grow. They have the wrong assumption. We're not soft touches. And what I saw in the room, packed full of people speaking, some terrified, some very clear and poignant to their points against this data center. I was immensely proud of seeing the involvement in local government and having your voices come forward. These aren't mom and pop operations. These are big corporations that are looking for the cheapest, quickest, least resistant place to build their data centers. And while our land is changing and we will see different uses of farmland as we don't have the population that's willing to continue to farm, isn't excited about farming, which makes me very sad. It needs to be done very strategically. And that's why I've mentioned before, I want to bring together township supervisors. I've been in contact with many of my township supervisors. I wish to work, across the board here with our other township supervisors to really unite and come together on plans moving forward for Washtenaw County, because this isn't the first and it won't be the last. It is coming. We can't stop the internet, Commissioner Somerville. I love that you said that, but that's not coming. So again, just really thinking about that we're places to live, places to farm, places to raise families, and we can strategically place industrial mega sites in industrial areas or areas that can be made industrialized. So I'm just calling all of my leaders to hold the line, think about the value and character of our communities, and, really pushing for transparency and community benefit when we're looking at these arrangements, obviously for environmental accountability, as we're going to be seeing for and passing tonight. I'm excited to have this come forward. But really above all, making sure that the right projects are going in the right places and that they're truly going to benefit the community and the users of that space. So we rurals, we have a voice and we have values, and corporations out there, we're not a soft touch.
Any other commissioners for public comment follow-up? I'm just gonna make sure. Commissioner Robbie, round 2.
I just put some candy in my mouth, so.
Of course.
It's candy first and then it's gum.
Well,
now-
it's razzles.
Okay, so I just wanted to say a couple more things that sort of the conversation made me think about. So one thing I want to say is, one of the things that's really so damaging about these data center proposals is the secrecy that comes with them. And particularly, I just want to speak to this, and this is sort of zooming out a little bit from just data centers, but all the money that the state allocates to corporate America on an annual basis through the SOAR fund and through other funds through the MEDC. When I was in the legislature, when SOAR first got created, and by the way, SOAR is the fund that's giving a bunch of money to the Ypsilanti Township Data Center. Well, when that was first created, I remember it because it was just during 2020 and 2021, in that time frame when I was in the legislature. And one of the things that struck me is that in order for legislators who were voting on projects to understand where the money was actually going or which projects they were going to, folks had to sign non-disclosure agreements. As elected officials, people who are duly elected by the public had to sign non-disclosure agreements in order to find information about where things were going to be located, what jobs were going to be, et cetera, et cetera. That is like a total violation of the trust that elected officials should have with the public. And I believe it's borderline illegal, frankly, to tell an elected official that they can't talk about a project that involves a private corporation when it involves public money, taxpayer money. So that's wholly and totally unacceptable. That the state has continued that practice for almost 5 years now. And the MEDC has continued that practice for 5 years. And I obviously made a stink about it then and continue to be mad about it now. But here we are seeing now the manifestation of what some of that means in communities where we're not actually getting the full story because a lot of these interests don't want people to have the full story. The other thing I want to say on the topic of AI, because we were talking about getting rid of the internet, which I appreciate. I would support that. But more importantly, I do think, I do want to just say on the topic of AI, I don't, while it is a force that is significant, while it is something that is sort of cutting edge and everybody's talking about it and everybody's starting to use it, I hope that we can come to a quick and collective realization of how damaging AI is. There is a school in Texas that is using AI to teach kids. This is not good, friends. AI is not like this amazing thing that's going to help all these people and save lives. It's literally ruining lives. It's costing people's jobs. Thousands of people are getting laid off across the country. People are turning to AI for therapy. I mean, and developing friendships with their AI bots that then lead them to do things that are not healthy. So let's not, this isn't like a criticism of anybody. I'm just saying, I want to speak out into the universe that we should not be normalizing AI and that we should be normalizing human relationships, that we should be normalizing meeting and greeting with our neighbors, that we should be normalizing human interactions over these, AI interactions, which by the way, only serve to make the rich richer, as we now know with Larry, what's his name, Ellison, the new richest guy in the world. is now the richest guy in the world because Oracle, because AI. And so let's not feed his empire. Let's not feed his machine, and let's just not use AI. It's that simple. And I hope that we, again, come to a quick and collective realization that this is not good for society, and that we don't need to build all these data centers, and that we don't need all this new computing capacity because it's actually not good. And the best supercomputer in the entire universe exists in each of our brains. And those brains, when interacting with others, create an even more supercomputer. And when one person interacts with another, that's double the supercomputer. And when there's 3, it's triple the supercomputer. And when there's 100, it's 100 times the supercomputer. And it's communities working together to build a better future.
Thanks, Commissioner Robbie. You just helped AI become more smarter.
No.
And AI is correcting me. It would be more smart, not more smarter. Commissioner Sanders.
I was just thinking out loud about, this is in relationship to the AI, to the data centers and our municipal partners in the county, and wondering out loud, this isn't a directive, it's an out loud thought about whether or not there is a role that the county could play in terms of possibly putting together consortium like training or education that would help, especially the smaller municipalities, understand better, because I don't want to make any assumption that they don't already know, but understand better ways that they could strengthen their firewall for things like this. You know, if there is a role that the county could play, of course, it would be volunteer. I mean, you can't make them do anything. And also to be clear that if residents don't already know, the county commission cannot tell a municipality what to do. And in this case, it's not up to us the best that we could do is do a resolution. We can't intervene. And related to AI, I have actually been asking, Commissioner Light and I have been asking out loud for electeds that are better educated on what these data centers are, to talk to us and explain what are the differences between the 3 that we currently have, you know, on the table here in Washtenaw County: Augusta Township, Ypsilanti Township, and possibly Saline. Because there is a lot of secrecy. But the one thing I haven't really heard anybody saying is a purposeful reach out to communities that currently have them, and whether or not it's been a positive or a negative experience for them. And what does that look like, right? I would like to hear from the electeds that voted on this, and to give us an explanation about, well, why did you vote affirmatively or negatively? But also, what other communities could we reach out to find out what is the truth? So once they're in existence, what has been happening? How has it either improved your community or started to ruin your community? But I've got concerns, and it's just hearsay, right? Because I can't get anybody to tell me anything. How much water? How much pollution? How many real jobs? Not the jobs that are going to be in play when they're building it, but after it's built, how many sustainable long-term jobs? And are those jobs open to our residents, or are they so highly skilled that we're either having to bring people in, or it limits opportunities for our residents? I've got questions about all of that, and how does it benefit
our generations that are coming up behind us? What are we leaving them with? Is this like a trash dump that just keeps getting bigger and bigger? Because although we live in a wonderful state that is a Great Lake state, water is not, fresh water is not infinite. It's regardless of what people say. And if we have to pay for bottled water now, which is ridiculous, but I'm not going to go down that rabbit hole. I would like better understanding because I like to be able to answer people when they're asking me questions about this. And I am at a loss for being able to provide explanations to them about what this might look like. And we need to be able to do that before it occurs. U of M is a little bit of a different animal because I don't want to say it's akin to like an eminent domain. They have, I'm going to say they have a pass, and there are limited ways that we have to be able to, and I don't even know that we have any for a municipality to say no, but we don't know what we don't know because nobody's talking about it. So if there's a way that the commission can try and gather some experts together that might be able to share that information with us, so at least we're being able to speak from an intelligent standpoint, I would appreciate any ways that we might be able to help with that. And also inviting our township supervisors and other leaders to be able to hear that same information at not necessarily any cost to them. I think that's it for me.
Thanks, Commissioner Sanders. Commissioner Hodge?
Thank you, Chair. Thank you to everybody that came to give public comment. Jeremy, I hope your recovery goes well. It's nice to see you still making it out to the meetings. Hope you're taking care of yourself. Thank everybody that came out, talked about data centers. Two of the data centers are proposed to be in my district, so I've learned more about data centers than I ever thought I was going to have to, and far more than I ever wanted to learn about. To Commissioner Sanders's point, I took a trip to New Albany, Ohio with Ann Arbor Spark, some of the elected officials from Augusta Township, and others involved to see the data centers there and to learn. Then I was able to see and be around a bunch of data centers to try to get a better sense of it. I think for what you're requesting, Ann Arbor Spark could help us have something like that, and we could host it here at a working session if that was of interest to people. But one of the key things that I learned about New Albany is that they have used data centers as their primary economic development strategy, and they have an overall strategy for their use of data centers. That's very different than what we're seeing here in other places around the country where they just pop up. They start popping up in places, and it's done in a way where there isn't really strategy around it. And I think that's the more dangerous thing for us to be concerned about. And I'm glad that people continue to speak out about that. If we don't have a strategy around it, I think that poses much more risk. New Albany was really purposeful. And I'm not saying it's good or bad. I mean, the environmental impacts are there no matter what, especially for them because they have so many data centers there. But they did it with data centers being the core of their economic development strategy. That's not what's happening here. So I'm glad that we do have this resolution that I'll be voting yes on that will create essentially a toolkit to be able to provide local governments with. I'll have a couple of questions when we get to it, such as I didn't see anything related to brownfield specifically in there. I don't know. Well, you say brownfield, and Nathan looks up like, all right. But maybe that's something we could talk about if there has to be data centers. Could preference be forced that they be on a brownfield or some exploration of that? I'm by no means a data center expert, but something I'm just curious about. But I think that the point is that Commissioner Sanders was making is very good. We all can't just go to New Albany and do the data center tours that Spark arranged that some of us went to, but we could bring that kind of information here, and I think it could be useful for everyone to get a sense of. I think that was all I wanted to respond to.
Thank you.
Thank you.
Commissioner Robbie, round 3.
Now I'm eating pita bread.
Last time you were eating candy and now you're eating pita bread.
It's, whiplash. What am I gonna? So
Okay.
I just want to quickly say on the topic of getting more information, I think probably we will hear, sort of a version from Ann Arbor Spark that, but I do want to just say quickly, we did get a presentation at, the Environmental Council as well from Michelle Martinez, who's a U of M, she works at U of M somewhere. And I think it would be, if we're going to have Ann Arbor Spark come in, I think it'd be valuable to have her come in as well to talk about some of the environmental issues that are associated with, data centers. So just wanted to put that out in the universe if we're going to do a working session on it.
Okay, thank you. Any other commissioner follow-up to public participation? Okay, I want to say thanks for everybody coming to talk about data centers. One of the things that struck me when we were talking about this and where people are talking about these data centers being, going up are often in those rural parts of our county. This week, it's not a liaison report, it's just a what I did this summer report. But this week, Commissioner Sanders and Light and I were at the annual Farm Bureau meeting, and it is inspiring to be at that meeting and to listen to what people are doing in the rural parts of this county. And I would love to make sure that we're doing what we can at this table to preserve those parts of our county. It's beautiful. It is some of the hardest working people that we have in this country and in this county. Some of them are in this room right now. They stay here late at these meetings and then go home and take care of their farms and animals. And it's just absolutely inspiring. Commissioner Sanders, I think, had a good point about wanting to talk to the supervisors. There's been a hiatus on this, and at long last, the supervisors are meeting again on Monday from 12 to 1. It's their meeting, but I do plan on being there to just listen. Hopefully they won't make or want us to talk, because they certainly listen to us talk for long enough here. So, but that will be coming up, and I am trying to get some of those meetings scheduled on different topics with our Director of Board Services, Ashley Hall. So stay tuned for that. I also want to thank Labor for your continued voice. I think in politics, I'm going to just reference Tim Olson's comment where he said politics is how we show each other we care. And that did resonate with me. I feel like it's why I got involved in this work, because I care about my community. And I want to thank you for reminding us that the dignity and rights of working people should always be at the center of our decisions. I think that they are at this table. And finally, very quickly, I also want to thank every one of my colleagues at this table for the work you bring. We don't always agree at this table, although most of the time I think we do, but our commitment to serving Washtenaw County, I think, is shared. And I'm really grateful for that, especially as we're getting into these muddy issues. And so with that in mind, I'm also going to ask that as we move forward in this meeting, we keep a focus on the agenda items in front of us and give them the attention and clarity that they deserve. And hopefully we will not be leaving here on the next calendar day of the day we are on. Okay, thank you very much. That ends Commissioner follow-up to public participation. At this time, I'm looking to see if there are any liaison reports. Liaison reports. Commissioner Machewski.
Thank you, Chair. Get to the right page. We'll note that this morning, the Board of Public Works met. And the final cleanup day for this year, I believe, is September 27th in Ypsilanti. And to remind everybody that there is, do you want to go?
Want to go, but I'm working. But yes, I have things I need to bring.
Yeah, we'll remind everybody you have to pre-register for these events as well. And you can do that at the Water Resource Commissioner's site on the county website. And also coming in late November or early December is the ever popular agricultural tire recycling event in Freedom Township. Don't have the exact date yet, but that's coming up. Let's see, last Wednesday, the Materials Management Planning Committee met at the LRC, and we began the discussion of organics in the solid waste system. And we actually have a special work group meeting tomorrow that's going to be held to further discuss this. Everything ranging from curbside pickup to drop-off locations. We had a really interesting presentation from makefoodnotwaste.org. And so I would encourage you, if you're interested in the topic, to visit their website and the MMP website at the county's page as well for more information about that. Maybe the most interesting statistic I got out of last week's meeting was, I think we're all familiar with the SNAP program, the food program. For every one meal that is served through a food bank, there are 9 meals that are provided to the SNAP program. And begin to think about what will happen if SNAP benefits are cut. Where will those people go? Many of them will end up at food banks, thus further stressing the food network across the country, but also creating more organic waste through the food bank process. So these things all come together, I guess. So those were a couple of things I wanted to note about MMPC. Thank you, Chair.
Thank you, Commissioner Machewski. Any other liaison reports? Commissioner Robbie Sanders next.
What's that?
I said Robbie and then Sanders.
Oh,
next. Yeah.
okay, sweet.
Yeah.
Thank you, Chair. Not eating anything this time.
Oh.
Just wanted to give some updates on parks. If I miss anything, feel free to fill in, because we had a nice, fun parks meeting out at Blackbird Lodge in Commissioner Light's district. So just a few things to update folks on here is, first of all, we've completed the Squires Preserve acquisition. Squires Preserve is a property that the county had been leasing for quite some time from the Squires family. Kathy Squires, a former employee of Washtenaw County, actually. So it's 5 acres for the entrance and 50 acres of land. Beautiful natural area that will now be county-owned property that has now been purchased, which is really exciting. We also purchased some of a conservation easement on some property in Augusta Township. I know Commissioner Hodge just stepped out, but we purchased conservation easement. I think Commissioner Light's familiar with that one, from Alpac, 77 acres for the room trust. So that was approved. And then we also approved repair on the Parks admin building roof at County Farm Park, and then at Sharon Mills, the wing wall on the dam there's some issues, and so we approved money for an analysis.
It's eroding away
Yeah.
on the side, on the sluice wall. Yeah.
Yeah, the water's like coming around.
Yeah.
So that got done. And what am I missing, Commissioner Scott? Did I miss anything? Art.
Art
You wanna talk about
in,
the art?
sure, we talked about in the new pool area at Mary Lou Rec Center. There was some concern that when this is being redone, that it's just going to be a big blank wall that people are going to be staring at, and what we could do there. So we are commissioning some ideas for how we might install art in there. And then I think that generated a larger discussion about how we can continue to generate art in the new East Side Rec Center as well. We also had the subcommittee meeting on East Side Rec Center where we looked at schematics again and talked about the initial price estimates coming in. RFPs for architects are out on that now.
Yep, so progress is happening on East Side, and we had the community town hall, which many of you were at. And I think things are finally moving in the right direction there. Just to note too, we also voted on submitting a TAP grant, which is something as your SEMCOG, one of your 2 SEMCOG representatives, I met with SEMCOG about to try to get additional dollars for the Eastside Community and Recreation Center. And so this would be money from the federal government, if there is still a federal government by then, that would come down through the SEMCOG region to Washtenaw County Road Commission and the parks to build additional sidewalk and trail capacity, not just on the site that's owned by the county, but also on the surrounding roads to increase pedestrian access to the site from the south and the north. And
Yeah.
it's $2 million. I believe,
Yes,
yeah.
and then in conjunction with that, then also talk to Parks and to our environmental, my Office of Resiliency, about how we can think about getting some PACE funding to try to help with some of the environmental work we'll do on that building as well. So I love that we're trying to think about how to leverage all the funding out there to get this building built.
Yeah, and just to emphasize, none of it's guaranteed,
Yep.
especially the TAP funding, but we're putting in the application. SEMCOG seemed really excited about it. But it all depends on what happens at the federal government.
Okay. With that existential crisis in front of us, any other liaison reports? Oh, Sanders, I'm sorry. I didn't write it down, so what in my head? Commissioner Sanders.
I need a left-handed chair. Um, just a quick, report. Commissioner Light and I, were able to attend the, Michigan Works, annual conference. This is my fourth attendance. I believe it's her first, in Kalamazoo. And the only thing that I really need to add, they had some very interesting, breakout sessions, as they always do. They did also have I guess we would consider her to be a keynote speaker on AI. She was quite interesting. But just to let the public know that Michigan Works is really on the line, and their funding for GoPro and WIOA can be in jeopardy with the changes that are going on in the federal government. And I think that maybe our average resident doesn't really understand how much those programs benefit the residents in Washtenaw County. Our area or Michigan Works Southeast actually covers is it five counties? It's five counties. I think it's five counties. And Washtenaw County has been holding its own when you look at the numbers and how they compare with the other counties in terms of successfully supporting our residents. So if people are so inclined, please feel free to reach out to your electeds in Lansing and also DC and let them know how important this programming actually is. So I think that's it. I think the only jab that I would add is that I'm going to make it official on the record so I don't have any problems later. The county did not pay for this travel. So hopefully we won't have any ongoing issues with, stealing money from the county for travel on behalf of the county residents. Michigan Works paid for this attendance at the conference.
Thank you. Okay. Anything else, Commissioner Sanders? No? Okay. All right, Commissioner Beaman.
Thank you. I'm just going to piggyback on what Commissioner Sanders says, as I attended the last Michigan Works Board meeting where they discussed all the wonderful conference. But the one thing that had been mentioned and we may bring forward with support is the local governments creating a resolution supporting the work of Michigan Works. I know that many organizations here benefit from it, especially with even the summer internship program that is up for being cut. And so just something for us at the table to consider as we work towards supporting our partners that really help those within our community seek, find, keep employment.
Thank you. Commissioner Somerville.
Yeah, thanks. In light of some of the comments about the federal and state budget, I am the liaison for the Commission on Aging, and I just want to point out that we are facing a potential state and federal government shutdown at the same time. And I would really appreciate if our admin team could potentially think crisis planning for how we can quickly get out dollars to prevent stoppage of service like meals. And just generally, I'll express the frustration that members of the Commission on Aging the aging provider community and myself as a person who cares about this issue, just like generally frustrated with waiting to push more dollars out. And so that is the update. I won't elaborate further because I think everybody knows how I feel about this, but I think we need to be prepared. And I think having a millage and having the money still sitting from this year, we need to make sure that we don't see a stop in service if the worst happens. Want me to
Okay.
go further, Justin?
Any other liaison reports? Okay, thank you. That ends the liaison reports. Next item on the agenda is report from the county administrator.
Thank you, Chair. To Commissioner Somerville's comments, we are doing scenario planning as we speak. So that is continuing to be a topic that we are focusing a lot of our bandwidth on. I don't have a formal report this evening. I do want to remind commissioners that we're continuing our conversations with our municipal partners related to animal control. And tomorrow I will be meeting with Pittsfield Township and the city of Ypsilanti. And again, after we have made our first round of, after we have completed our first round of conversations, we will be back before you with an update on that process and framework. That will conclude my remarks this evening.
Thank you. And hoping that after this meeting starting and the report from the county administrator, we'll always have a little report on how things are progressing on East Side Rec Center.
That is correct. You and I spoke about that. I didn't know you wanted to illuminate that this evening, but we have talked about that being a permanent placeholder on my report. So in the future, you will certainly see a category that speaks to that.
Thank you so much. I think that will be good for everybody to know. I have no report. That's the next item on the agenda, and there are no special orders of a business. So would anybody like to move the appointments?
So moved.
Thank you. Second, anyone? Thank you. We'll do a roll call on that. Brendan, could you call the roll?
Sure can. Commissioner Beaman,
Yes.
Commissioner Hodge.
Yes.
Commissioner Labar,
Yes.
Commissioner Light,
Yes.
Commissioner Machewski,
Yes.
Commissioner Robbie, Commissioner Sanders,
Yes.
Commissioner Scott,
Yes.
Commissioner Somerville.
Yes.
Item passes.
Motion
Yeah.
passes.
Yeah, thanks. All right, consent agenda. Would anyone like to move the consent agenda?
So moved.
Support.
You, that's a voice vote. All those in favor?
Aye.
Any opposed? Fantastic. Next is, would anyone like to move the first reading resolution? Commissioner Labar.
Sure. Under first reading, a resolution modifying the soil erosion and sediment control fee schedules and creation of one FTE. B, a resolution authorizing the signature of the county admin on the lease with Watts.
Is there support? Thank you.
Support.
Anybody, is there any discussion on either of these items? Commissioner Hodge?
Thank you, Chair. I will vote yes on it, but I did want to just raise this for future consideration around the lease with Watts, and not just Watts specifically, but with many of the external entities that we lease property, or not property, space with, as we get worried about our ongoing financial situation, especially as it relates to federal and state funding and our own needs for space. Particularly as we're developing the Office on Aging, I would want us to be thoughtful about how we're using the space. Could there be, as Commissioner Robbie has talked about from time to time, other strategies around using existing space for revenue generation? And then what space do we need for our own employees? So I'll vote yes on the lease this time, but I want to be looking at this lease and other leases in the future.
Commissioner Robbie?
I am of the complete same mind as Commissioner Hodge. The complete same mind.
Sounds like,
In its totality.
sounds like AI to me.
AI, yeah, we're hive minding. That's right, exactly, yeah.
Okay.
I do also, if I may
Yes.
just quickly say too, I want to thank the Water Resources Commissioner for one, increasing revenue, and two, creating a union position and replacing, I believe replacing seasonal staff with a full-time union position. I would love to see this in more parts of the organization and want to thank her for bringing this forward.
Absolutely. Any other comments on these items? Okay, this is a voice vote on first reading. All those in favor, please say aye.
Aye.
Any opposed? All right, items will pass on to the next meeting. Anybody would like to read the final reading resolutions? Let's do final reading as one and then single reading. So final reading, Commissioner LeVar.
Two, under final reading, A, a resolution approving the CMH budget. B, a resolution amending the 2024-25 community mental health budget. C, a resolution authorizing the admin signature on the Health Department's comprehensive agreement, October 1 through September 30th, 2006. D, a resolution appropriating $1 million in American Rescue Plan Act interest earnings. E, a resolution ratifying the county admin signature on the grant agreement with Superior Township. F, a resolution to adopt the Broadway Park redevelopment brownfield plan amendment number 1. G, a resolution approving the opioid litigation settlement with various generic manufacturers from Corp Council. H, a resolution approving the opioid litigation settlement with defendants Purdue Pharma and the Sackler family, Corp Council. And that is it for final reading.
Support.
Okay, would anybody like to pull anything for separate consideration? Commissioner Robbie? F. Oh, okay, F. Just let's remember to talk to the item on the agenda, please. Clearly, I don't entirely agree, but anybody else want to pull for separate consideration? Okay, any discussion on any of the items other than F? Commissioner LeVar.
Just briefly, I want to thank the CMH staff for their budget development and all the work that's gone into it.
Amen. Ditto to the Health Department. Thank you. If I can just jump on that comment. Any other comments on any of these items before we do a roll call here? Okay, I see none. Brendan?
Commissioner Hodge,
Yes.
Commissioner Labar,
Yes.
Commissioner Light,
Yes.
Commissioner Machewski,
Yes.
Commissioner Robbie, Commissioner Sanders,
Yes.
Commissioner Scott,
Yes.
Commissioner Somerville,
Yes.
Commissioner Beaman.
Yes.
Motion passes.
Thank you very much. Now we're going to discuss item F, a resolution to adopt the Broadway Park redevelopment brownfield plan amendment 1 from the Office of Community and Economic Development. Commissioner Robbie?
Thank you, Chair. I'm just gonna make a statement. I don't have any questions to ask. So y'all can sit down, stay seated. All I want to say, y'all are looking at me, y'all are chuckling. You know exactly what I'm gonna say. You've
Yeah.
heard this now 3 times. Yeah. Just pretend that you've never heard this before. But no, I'll keep it brief, okay? That essentially, we know who made the mess on this site. It's DTE. Mishkan, DTE, they bought them, they took on the responsibility. We know who the responsible party is. We know who should be cleaning this up. And now almost $40 million of taxpayer money, including the $17 million in this brownfield plan, are going to be spent in public money to clean up a private mess that a known polluter made in our community. A known polluter, by the way, that makes $1 billion in profits every year, that has the resources to clean this mess up. $40 million of public money now are not going to be spent on roads. That's money coming out of our roads millage, coming out of our affordable housing millage, coming out of our sustainability millage, coming out of our every millage that we have to pay for a cleanup for a private project that will result in somebody making money. Public money should be used for public purposes. I'll be voting no. I know this is the final vote. This is the final time that you have to hear me talk about this. I'm probably going to be the only no vote. That's okay. I want to register why I'm voting no. It is a firmly held belief. Public money should be going to public purposes. Thank you.
Thank you, Commissioner Robbie. We laugh, but we appreciate your passion. Thank you. Commissioner Hodge?
Thank you. Commissioner, I don't know if Commissioner Robbie saw or not, but there was a written public comment that really echoes much of what he has said the last several meetings. So I didn't know if he wanted to say anything about that public comment that was clearly inspired, I think, by many of his comments over the last few meetings.
Commissioner Robbie?
Thank you to the public for paying attention and submitting that comment.
Okay, thank you. Anybody else with anything to say on this item? All right, let's have a roll call vote on item F.
Commissioner Labar.
Yes.
Commissioner Light.
Yes.
Commissioner Machewski.
Yes.
Commissioner Robbie. Commissioner Sanders.
Yes.
Commissioner Scott.
Yes.
Commissioner Somerville.
Yes.
Commissioner Beaman.
Yes.
Commissioner Hodge.
Yes.
Motion passes.
Thank you very much. Single reading, who would like to move the single reading items? Commissioner Labar.
A resolution authorizing the emergency management work agreement and signature of the county admin on the local budget for emergency management performance grant from Sheriff's Office. B, a resolution celebrating the 10th anniversary of the Washtenaw County Dental Clinic. C, a resolution directing Washtenaw County staff to develop informational outreach materials on data centers for local municipalities and urging local municipalities to require a set of recommendations for data center approval. Chair, would you like me to also move claims?
Yes, I would.
I will move claims in addition.
Thank you. Is there a second? Thank you very much, Commissioner Beaman. Anybody want to pull anything for separate consideration? Any discussion on any of these items? Commissioner Hodge?
Thank you. Is there anybody here from the Resiliency Office to talk about the resolution that came from them?
I don't think so.
Or
The, you, if I could give the, wait, time out.
Chair, if I may, so Beth Gibbons from the Resiliency Office
Right.
was not able to join tonight, unfortunately. So no, there's no one
Okay.
online to speak to it.
I do have two members of the Environmental Council that on this board that seem eager to talk about it. Do you have more questions for them than what was covered in public comment, public participation comment?
It's largely, thank you. It's largely what I had mentioned in my response to public comment about the brownfield piece. There's the set of recommendations, and then I would imagine that as the toolkit or whatever it's going to be called gets developed for local governments, that maybe that would be a component of what could be suggested or talked about. I didn't know if that came up in any of your discussions in Environmental Council, so I was just curious.
Commissioner Somerville or Robbie? Robbie?
I guess the only thing, it didn't really come up, to be honest with you. And the only thing I would say is primarily like, while I think I understand the intent of where you're coming from, I think what you would hear from Environmental Council members is that, you know, it's sort of like, it's not just that we don't want this in, you know, rural parts of the county, it's that this is a problem anywhere. It's gonna have the same impact on our energy, it's gonna have the same impact on our water. And so we wouldn't want, I think that you would probably hear folks saying we wouldn't want it to be a disproportionate burden on certain communities where those types of brownfields are usually found. And so I think those would probably be some of the concerns that you would hear about that typically, but understanding where you're going with it, which is, you know, let's reutilize, which is I think what Ypsi Township is pushing for, to reutilize a site that's a former industrial facility.
Yes, you understood the intent of my question. Like you said, we're minding it today. And this was a question that one of my township supervisors was very interested in. So thank you for answering the question. That's all
Okay,
the end.
thanks. Any other questions, comments, or concerns on any of these three items? Okay, I hear none. Brendan, that's a roll call.
All right. Commissioner Light.
Yes.
Commissioner Machewski.
Yes.
Commissioner Robbie. Commissioner Sanders.
Yes.
Commissioner Scott.
Yes.
Commissioner Somerville.
Yes.
Commissioner Beaman.
Yes.
Commissioner Hodge.
Yes.
Commissioner Labar.
Yes.
Motion passes.
Thank you very much. Item 12 on the agenda, items for current and future discussion. Anyone have any items for current and future discussion? Commissioner Robbie, then Sanders.
I don't think this meeting is going long enough.
No, stop that. Commissioner Sanders?
What happened? He didn't say anything?
That's what he wanted to say. He's done.
So this Saturday, there will be a Michigan Collaborative Summit on Human Trafficking. I am hosting them at the LRC. It starts at 10 a.m. and I think it goes until 2 or 2:30. So I'm still waiting on an answer from them about whether or not it is open to the public. It is currently open to other counties that also have organizations that are committed to eliminating human trafficking. So they asked me if I would share it from the board table, and that's what I'm doing.
Commissioner Sanders, I wonder if it's interesting to think about in the future if that could be open to healthcare providers. We're all required to do continuing education credits on human trafficking, and I mean, if you could get doctors and nurses and social workers in there to talk about that too, it seems like it.
Absolutely. I'll inquire and I'll let you know. And if
Thanks.
not, at least inquire whether or not we can have a part B.
Yeah, fantastic. Thanks. Commissioner Somerville.
Yeah, thanks. I know that the administrator didn't provide this in his report this time, but just for everybody in the room and whoever might watch this later to know, we did have a public meeting last week with an update on the Eastside Rec Center. I just want to thank our admin team and Parks and Rec staff for speeding up the process to put out the RFP for the next phase of the project. The timeline right now is that construction will start in 2026. I'm really grateful for the turnout that we had. And I think it was a good example that people are excited and we need to just keep the ball moving and be able to do multiple things at once. And so one of the things that I made sure that the public knew both at the meeting and then later online, when I shared some public information on my county commission social media accounts, is just that we've already been doing the work to set aside operational funding. We've already been doing the work of encouraging the Parks Board to consider their future budget expectations and goals. And I think I also just want to address it here in this room too, is that this is a unique site that we're building. The Parks Board has never built a community center like what we're doing. And so I just want to make sure that people understand that this is new and we're going to have to do creative things and spend extra time clarifying for the public, because I understand why there might be mistrust, because this is a project that's been talked about and fumbled, not by anybody in this room, but by other people for a long, long time. And we can't lose sight of the fact that like we are super close to having this actually be done. And so I'm thank you for all the staff that have listened to me complain for the last 2 months. Sometimes complaining works. So thanks, and go Lions.
Commissioner Sanders.
I just want to piggyback on Commissioner Somerville and take an opportunity to do a two shameless plugs. One is that even though the Eastside Community and Rec Center is being managed by and operated by our Parks and Recs department, that center still is in need of support from sponsors. So if there are people in our community that would like to be a part of this historical project, we are open to receiving support. I've had a couple of conversations, and so far we've got people saying, what do you need? And so we need more people asking, what do we need? And I would invite them to reach out to Megan and have some discussions with her about any types of resources that they would be willing to bring to bear. That's the one plug. The second plug, shameless plug, is for the upcoming Towsley Eastside Part 2 Alpha House. And so we've got 2 floors. One is phase 1, one is phase 2. They both have the capacity to have 30 rooms for families, and they are gonna need support. So they have a building. The county has done an excellent job, I think, along with City of Ann Arbor, of providing them with funding to take care of the roof and things like that. But 30 rooms, I think, is monumental as we approach the winter, to be able to house families and their children, and having, restroom facilities in each room. And so those rooms need to be decorated, and they need bedding, and they need all types of things. So I would encourage people to reach out to Alpha House if they are so inclined to support, and really to consider, turning in some pennies at the penny bank, and providing that support, because that's phase one. And then phase two, we're looking at another 30 rooms in the near future, but also a gymnasium and a commercial kitchen. So just want to put that plug out there and say thank you very much to the partners, Trinity Health, for gifting Alpha House with yet another building. That's huge. So it's not my district, it's Commissioner Light's district, but I still feel a pride point there. So I don't know if she has anything to add.
Thank you. Any other current items? Oh, sorry, Robbie.
I just wanted to quickly, and I don't want to open this can of worms fully. This isn't a board issue, but since we're on items for current and future discussion, and I have a mic in front of me, I just want to say it. I'm very troubled by the recent development with Jimmy Kimmel getting canceled on ABC. And I just want to just quickly say, I know we want to try to end the meeting on time, but we were on the precipice, and now we are falling down the cliff as a country. And the fallout from, what people, not just Jimmy Kimmel, but others have been saying is really troubling to watch. That, some of the same people that were so concerned about what they called cancel culture are now engaging in something that I think is even worse than cancel culture. And we're seeing it replicated all over here now. And it is permeating not just around this issue, but other issues as well. We are losing our ability to speak our minds in this country, which is a basic and core tenet of who we are as Americans. We're supposed to be able to speak our mind, and we're supposed to have the right to free speech. And yet, there is a double standard when it comes to free speech. And we're seeing things like what just happened. And I'm very concerned about it. I'm very concerned for our country. I know that there's, we are all elected officials around this table, and, we can all speak up. We all have been speaking up. And I just, as this continues to unfold and continues to happen, I think we need to condemn it in the strongest of terms, because people should be able to speak. And in reading what Jimmy Kimmel said, to me, it is not a fireable thing to say. It is really part of the discourse that we need to be having in this country around all of these issues. So I just wanted to make sure to take a moment to say that, because this was a very consequential action that occurred that is should be condemned in the highest terms, the decision that ABC made.
Thank you. Commissioner Beaman?
I just want to piggyback on that because a man that I care about, Jerry Greenfield of Ben and Jerry's, has left Ben and Jerry's because he is also being silenced and the brand is being silenced. And he came to the University of Michigan Ross School of Business to speak to my students, and he's an amazing man. Created a beautiful company that united us all through ice cream, but also we all love ice cream. But also through social issues. And so it's just very disheartening to see a namesake have to step away from a company that they built from nothing for these issues. So just piggyback and yeah.
I think you're right. You guys pay close attention. I had the joy of getting maybe close to 100 emails along with officials at the University of Michigan and the city of Ann Arbor asking us to work to fire a professor at the University of Michigan for comments he made. this man is a man who teaches an anti-racism class and a power, privilege, and politics and the difference of higher education. You might just guess what he was saying that made people mad. This is alarming to me to get emails from people asking me to try to take somebody's livelihood. This is somebody who's saying things that I stand with him on, but even if it was somebody who was saying things I didn't stand with, I would not be working to end somebody's livelihood for that. So you're right. We've gone over the precipice, which is part of why this evening I wanted to just say thank you to all of you, because it's good to sit down at this table with the 8 of you, of my colleagues and the other people in this room, and do this work and feel like you're engaged in the world, because as long as good people like us are engaged, there's still a fight left. Okay, that's end for items for current and future discussion, unless anybody has anything else to say. I know we do. Okay. The next item is the pending item. We're just going to pick that up. Any questions, comments, or concerns on item 1 and the pending item? Commissioner Hodge? Commissioner Sanders? He said you could, he's deferring.
I just wanted to get clarity from administration that the item that I was requesting be turned in, the revenue from both of the transportation companies has been received.
I'm going to go to Brady. Go ahead.
Thank you, Chair. Yes, the requested documents have been received and they
Okay.
are in the packet tonight.
Thank you.
Anything else? Nope. Commissioner Hodge?
Thank you, Chair. Brady, I got a couple more questions for you. All right, I don't know if you want to be at the podium, if you want to sit there. It's up to you. Yeah, I mean, if you get.
He
you
wants
know,
to sit.
He wants to sit.
Yeah.
Okay, so I think, last meeting I tried to get some clarity with my questions, and I don't think I was direct enough with it. It was my assessment during the last meeting that People's Express had submitted everything through the RFP process that was asked for. Is that correct or is that incorrect?
That is correct.
And so it was submitted before the last meeting and it was in our packet.
Correct.
Correct, okay. And then I think there were some questions around what JFS had submitted and what they had not submitted. And if I understand correctly from what you said at the last meeting, the review committee was satisfied, minus you specifically, with everything that had been submitted. But that's why administration had recommended that we pass it at the last meeting, because almost everyone on the committee was satisfied with the information that was submitted.
That is also correct.
Okay, just wanted to make sure I understood. That's all I got, thank you.
Any other questions, comments, or concerns? Commissioner Robbie?
Thank you, Chair. I am going to be voting yes on this with some reservation. And I do want to state with my yes vote that I never want to see this type of thing come up before us again. I think that it is unfortunate that we set out a clear scoring process and then didn't follow it. I think it's an unfortunate development. I think that if we are going to have future RFPs, which I think we should always be doing RFPs, we should have clear and concise scoring criteria or a clear and concise process that we engage in that is open and transparent. And then we should follow it and actually fund organizations based on the scores that they achieve. And by the way, those scores need to be, there should not be room for subjectivity in the scoring. It should be an objective list of criteria that is not subject to an opinion necessarily of a staff member, a group of staff members, or even us. I think it should be as objective as possible, understanding that it cannot be fully objective. And so, I think that is an important feature. And I also want to say too, I think that there needs to be in that process an evaluation of whether the organizations that are applying for money can actually fulfill the things that they're doing. Because if somebody is submitting an application with promises that sort of game the scoring system, that say, well, I'm going to serve a larger service area or whatever to gain more points, we need to be able to evaluate how realistic that even is. And so I think that what you heard from this board last time as a staff team is a desire to raise the bar on public money and to make sure that we are allocating funds with the most rigorous process that we can in place to make sure that these funds are being allocated in a way that is most impactful to the community. And I think in order to achieve that, we have to be true to the public process that we set forth, and be as unsubjective as possible, and as objective as possible in our allocation, and increase our fidelity to the processes that we've laid out and agreed to as a body. So with that protest, I'm going to vote yes, because we have gone and sort of engaged in this process. We've brought these organizations through the process. They've submitted the paperwork that we've asked of them. I still feel uncomfortable about the 1/3, 1/3, 1/3 split. But I think if there is a commitment that this will never happen again, then I'm willing to vote yes, and move on to 2026, hopefully with new processes and a more strict adherence to the rubrics that we set forth. Thank you, Chair.
Thank you. Commissioner Sanders.
I'm gonna blame this all on Commissioner Robbie, because if he hadn't said what he had to say, I was just gonna be silent and let things slide, but he started it, so. I guess I want to add to his comments that I want to be clear, because there have been some allegations lobbied against myself and Commissioner Light since the last meeting that I don't appreciate. I also am a pretty direct person, so if you got an issue with me, I'm available. I don't like the, going behind the scenes and whispering things to people. Got something to say it to me. But I want to be clear that from the moment I took office, I was clear that what I expected was honesty and transparency and fairness. And that means that none of the 9 of us should be engaging in any undue influence that subverts the processes that are in place. We should not be putting pressure on any of our administrative staff to do something that they are not supposed to be doing, or that they have received directions from us as a body not to do in order to favor any particular agency. Because that is what makes things inequitable here in our county. And one of the things that I committed to, and I'm still committed to, much to the chagrin of many, is that we are fair. That the east side, the west side, and the middle all have a fair opportunity to bid and compete for business with the county without having this air of entitlement that, well, so-and-so promised me this. Not one of us sitting at this table should be making any promises of anything to any person or entity without the agreement of the board. It's outside of our scope of responsibility. And it needs to stop. It's been happening for decades. It's time out for it. Either you're qualified and you are able to do the job, or you're not. But when we have a process in place for RFPs, that, by the way, is a legal process. So if an entity applies and they do all that they're supposed to do, and they don't get a contract and they want to challenge us, they can do that, and we better be able to back up what we did. So what happened at the last board meeting was about following the rules, contrary to what has been whispered out in the community. I don't appreciate people trying to impugn my reputation at all. You got a problem with me? Ask me. But it's about fairness, and it's about people following the rules. We should not be accepting any packet that is not complete. When you're bidding on grants, it's very clear. If they say 100 words in your summary, that's what they mean. They don't mean 101. If it's due at 11:59, that's what they mean, not 12. And people are rejected. Applications are rejected because people don't follow the guidelines. So I just wanted to be clear, and thank you very much, Commissioner Robbie, for opening that door for me.
Thank you, Commissioner Sanders. Commissioner Beaman, did you have your hand up? Thank you.
I'm just going to piggyback quickly on that. I also agree, there's a process for these. If you go back and replay the tape, I asked Corp Counsel, if we did this for one organization, would we have to do it for others? And the answer was basically yes. And I had an organization come speak to me after the meeting saying, yes, if you pass that through and I came for an RFP, then I would want that same consideration. And they're a person that's pushing to have these senior dollars out in the community. So we have to do what's good for the community. We have to be responsible. That is our role, fiduciary responsibility of the board. This isn't an organization that we don't trust. It's not about trust. It's about following a process and questioning to ensure that we are following that process and respecting the organizations that apply, but also respecting our residents and the tax dollars they're putting into this millage. Thanks.
Thank you. Commissioner Labar?
Thanks, Chair. Appreciate all the diligence that's gone into this item, especially at this table. Just think it's a good time to say again, I think we're fortunate in this community that we have some of the external partners we do. They make work that resonates with really the heart of the 9 of us and why we are here possible. And so I appreciate them, and process questions are always important. I'm glad we got that settled out, and I'm really looking forward to those first bus rides for seniors that are getting service away from their place of residence. And I hope it's something we can build on and build on soon. So thank you, Chair.
Thank you very much. Any other comments, questions, or concerns? Commissioner Machiyowski?
Thank you, Chair. I would just like to add that, we've set up a process here with these millage dollars where we have a review committee and then the board voting on that. I don't know if that's unusual. It creates almost like 2-step process, right? We're having a review committee and the board engage in this. So it is brand new for us. And my expectation going forward is that we've kind of smoothed it out, hopefully here. And the process going forward will be very efficient and effective. I would like to add that while we've had a couple of weeks since our last discussion, one of my concerns when I was reading through the proposals was the actual ability to deliver on the rides. And I've taken some time to look at that and see how that could be accomplished. And I'm, after talking with these companies, I'm quite excited about the opportunity I think that they have to accomplish the things that they have written. While I was skeptical at the beginning about the idea of doubling ridership, that's a lofty goal, but understanding that there is already infrastructure in place that is available for this, I feel pretty confident. And I'm going to go back to some of my comments from the last meeting about outcomes and measuring outcomes in data and understanding what we are getting for these millage dollars is really important. But I think the time that I've had since the last meeting just to look at this has made me comfortable, because I know that these 3 vendors, these 3 transportation providers have the experience, and they are going to do a fantastic job for the older adults in our community. I feel pretty confident in that. So I'm excited for the ability to move on and hopefully get a much larger RFP process going for the rest of these dollars and getting that money out in the community. Thank you, Chair.
Thank you very much, Commissioner. Any other questions, comments, or concerns? Okay, we will vote on this item now. Brendan?
Commissioner Machiyewski,
Yes.
Commissioner Robbie, Commissioner Sanders,
Yes.
Commissioner Scott,
Yes.
Commissioner Somerville,
Yes.
Commissioner Beaman,
Yes.
Commissioner Hodge,
Yep.
Commissioner Labar,
Yes.
Commissioner Light.
Oh, she's not in here.
Motion passes.
Thank you very much. Nothing left on the agenda except Commissioner Robbie?
Thank you, Madam Chair. I'd like to make a motion to adjourn.
Oh, second,
All those in favor?
second.
Let's go home. Thank you.